Namaste, everybody. Welcome to another edition of our podcast, Rebooting the Brain. Today is a very exciting episode of Valentine's Day special. Before I introduce to the Valentine, let me start with the Shanti mantra. Om Asato Ma Sadgamaya Tamaso Ma Jyotirgamaya Mrityorma Amritam Gamaya. Om Shanti Shanti Shanti. This shloka has been a driver and inspiration for me right from my childhood. And as the shloka says, from darkness to light, from ignorance to enlightenment, and from death to immortality. You can use this theme and this philosophy anywhere in your life, any single day, and get maximum benefit. Try it, guys. Before I go into the topic of the day, some housekeeping rules. Please don't forget to subscribe to our channel, Rebooting the Brain, both on YouTube and on Instagram. And don't forget to like our videos, share them, hit the bell icon, and definitely put your comments because your comments helps us to improve the algorithmic reach for a lot of new people who will definitely benefit from our content. And please go back to our library and see a lot of our old content. There's some valuable content there, and all those who've been supporting us so far, thank you very much. And we'll promise to bring you world-class content. So nearly 1800 to 2000 years ago, the Kama Sutra was written around that time. And it talks about the Dharma, Artha, Kama, and Moksha. These are the four fundamental philosophies and pillars of the Vedic civilization-driven life. Dharma is about living an ethical life, with principles. Artha is having a prosperity and making money the right way. Kama is obviously intimacy and love making. And moksha is inner freedom and enlightenment. And having an ideal dynamic balance of these four is critical to have a completely fulfilled life. I am saying that, Kama Sutra says that, the Vedic civilization says that. But somewhere along the way, the last couple of 100 years, this philosophy of Kama Sutra has been lost, and people have gone into the Western culture of materialism and looking everything through one lens, one dimension, and they have lost it. A lot of people think Kama Sutra is a sex manual. It is not a sex manual. So, guys, to learn about all these things, I have a fantastic gentleman with me, my dear friend, a sexologist, Shivadev. Shivadev, welcome to our show.
Thank you, sir. That was a very apt introduction about Kama Sutra that you gave right now.
Thank you. So, Shivadev is a psychiatrist, he's a sexologist, and he's here to tell you about some of the most forbidden conversations that people want to have, want to know, but don't want to talk about it. I don't know how you learn about it if you don't talk about it. So, Shivadev, so before I ask you the question why you're called a sexologist, I want people to know that whenever I introduce myself in any forum, I tell everybody I come from the Silicon Valley of India, which is Bengaluru. I come from the original IT industry, which is the central nervous system. And third one, I say in the world of AR, MR, VR, AI, MI, all of the ML and all of those things, I come and we come from the world called RR, which is real reality. Our patients are real, their sufferings are real, our treatments are real, the results are real. Nothing virtual in any of these things. But recently you shared a story with me of a young girl who had an intimate relationship with ChatGPT. I mean, where is this world heading? So, Shivdev, welcome to our show.
Thank
I'm
you.
sorry to put you on this spot right as off the bat, but over to you.
No, thank you, because this is very apt right now as we are speaking, because the AI is in huge boom. And then the way that people have been starting to use AI is not just about information gathering, but also to sort of use it as a journaling method or to vent out because they are not able to have real connections with real people in this world. So that's
Very
the
sad.
larger picture.
1.5 billion population.
Unfortunately, you have 10,000 people on your friends list, but how many are actually in connection with you? So this puts them into a state of loneliness where they are not able to reach out to certain people, or people are not available. So it can start off as a casual chat or a transactional chat, and then start to think about what's going on in their minds, and then they start getting that agreement from these engines, right? So once they start getting agreements, they start getting attuned to that, and then they get into this compulsive cycle of asking a question, getting an answer, asking a question, answer. The amorous relationship also starts. They start feeling lonely, and then somebody is there to support you. So this starts giving that chemical thing in the brain, and then they get hooked to it, unfortunately blurring the reality. The most important problem
You
here
can cheat
happens
the
to
brain
be
also.
exactly because you don't understand your own biases. You stop thinking that it is actually not a real human being, and it is so perfect because nobody is disagreeing with you. There is no other conversations that's
They're
going off.
validating what you're
They're
saying.
validating what you're saying. There's no arguments. So even if you ask like why this can't be in this certain way, it says okay, I can be this. So it starts getting into that kind of a relationship, and it is more of an obsessive compulsive process that develops here, which gets them hooked.
Amazing. And as I read that article that you shared, I saw that she was actually changing the persona of the engine so that she would choose how that person has to interact with her. And it was like an illicit relationship, but with no physical human being on the other side. It is crazy. I mean,
Yes.
it's crazy. I don't know, guys. See, there are human beings around. We are still old fashioned. Our brain is still a wired model. We still need five things in life. I tell everybody we need health, happiness, peace of mind, love, and relationships. And none of this five money can buy, and none of this five ChatGPT can give.
ChatGPT can give, or any other AI
Yes,
engines,
no
so
other
to say.
engine can give, and this is not going to change in a hurry
True.
because the human body is designed like that for millions of years. It's not going to change. So before we dig deeper into the Kama Sutra related philosophy of life and the current struggles in the field of intimacy, sexuality, and everything else, why are you calling yourself a sexologist or a sex health specialist? You're a psychiatrist fundamentally. Can you educate our audience about what this is all about?
I call myself as a psychiatrist and a sexual health specialist because sometimes the word sexologist can be misleading to a lot of people because it
It's
could
too
refer
sexy.
it is referring to someone who probably reads about sex or something like that. But it has been commonly used as sexologist. Even everybody is using sexologist just to go with the fact because even during our training, there's no special department dedicated to this, unfortunately, and it is multidisciplinary anyway. So I want to bring in psychiatrist and sexual health specialist to bridge that psychosexual health, to bring in that connection of the mind and the body together. Or else people will think that you're just looking at the organs, or you just are a psychiatrist who doesn't know anything about the organs. So this connection I want to bring in. So hence I start introducing myself anywhere, even in my professional pages and all of that. It's psychiatrist also mentioned very specifically, and sexual health specialist. So they understand the neurobiological aspects, the psychological aspects, or anything that's involved with it, along with the emotions and lifestyle, the whole holistic approach to things.
The reason I'm having this smile on my face, you must be wondering why I'm
I was
smiling, is
wondering
because,
actually.
yeah, so that's why I realized that you are wondering. So as you were talking to me, I got this standard dialogue of mine I thought is very appropriate here. Is see, this is the struggle we are facing in the field of neurorehabilitation. When the leg is paralyzed, they treat a paralyzed leg because of a cortical injury, like an orthopedic situation.
Mm.
And because the musculoskeletal rehabilitation is what is predominantly known to people, and neurorehabilitation is still reasonably unknown. So when they approach the limb with the musculoskeletal approach, the results don't come. So
The
the one
connection
of
has
the
to
big
go on.
things I tell them is, even to my neurosurgery colleagues, guys, the problem is upstairs, not downstairs. So you are telling the problem is both stairs,
Both
both
states,
upstairs and downstairs.
they have
S-
to sync up
Exactly,
beautifully.
absolutely. The mind-body connection has to
It is
happen.
such a wonderful connection. It
Yes.
amazes me every single time that I'm working with someone and then we're able to help them reorient themselves. It is a beautiful system.
So, guys, I promise you at the end of this conversation, you people will get a clear idea of what to do, and more importantly, what not to do with yourself, your relationships, your life, and everything else that happens. So, as we dig in further, you call your clinic as passion fruit top notch. So when I read this passion fruit, I said there must be some double meaning in this whole process of communication. So tell us why this passion fruit and everything else, because that'll set the context of
True,
what's
true, sir.
happening.
I get this a lot from a lot of people. Why did you call this as passion fruit, and what's with it? What's the fruit got to do with it? But I wanted to position this brand or sexual health aspect in such a way that it has to be subtle, yet speaking about something that it directly means. So I actually, this was a long time ago. We were thinking about all these things, and we didn't know what to come up with because we started having things like men's health clinics, sex clinics. So this was too much in your face. So we wanted it to be a safe space, a dignified space, a space where people can feel very open to come and talk about any of these problems. So we wanted to reduce stigma. There is a lot of difficulty in people thinking, should I even be going there? Is this only about a male problem? So passion fruit projects that kind of the most important thing of passion, which is transcendental, and also evokes that, ignites that thing inside you and makes you realize that this is something I need to reclaim. So the fruit part of it, or the subtle meaning that I wanted to come up with, that is that the evidence based scientific things that we're doing which provides you with the results. So I wanted to club that. It has many layers, so abstract thinking people have actually appreciated that, and some of them, when concrete thinking is there, they don't get it. Then what's the fruit got to do with it? But that's the meaning of it.
Brilliant, brilliant. So we are going to talk about the three P's and the three S's now. The three P's are pleasure, protection, and performance. The three S's are sex, size, and stamina. So now you tell me, you can take any of these six words to start. I leave it to you.
Got it.
Yeah,
They're all connected in a way because the pleasure, performance, and as well as
protection.
protection, right? So the protection, without this safe space, without consent, protection comes as the most important trust building factor, because without protection there is no pleasure. If you don't feel safe, I don't think the brain will enjoy that at all, and it comes with a kind of vulnerability issue that you're not able to get in. So protection is not just about the contraceptives or the condoms and hygiene, which is also that, but along with that, the mental protection that it is there,
I
the
didn't
kind
think
of,
about this actually.
yes, the
I was
kind of
thinking of the physical
establishment.
protection.
Physical protection is
Yes,
definitely needed,
yes, I didn't think about
but
this.
along with that, the consent. Am I willing to? Because there could be a lot of debate inside
Uh,
your own mind that, should I be physical with this person or not? So in that
Especially if it's
case,
out of a relationship or it's a
exactly.
one night stand, anything like that.
Yes. So it is important to feel that kind of safety, that trust that I am okay to be vulnerable with this person. So the protection is a very important concept of, the three P's that we talk about, as you mentioned, for the pleasure to come in.
Got it.
Because once the pleasure starts, then it could be the entire loop of how you can get lost. And in the end, if you don't feel safe, then you get into this anxiety loop later on. So pleasure also is derived from many factors, as we are aware of, right? It is not just about the attractability.
True. Agree. And if you, let that go, you can have fantastic pleasure. And that's when the whole
Exactly. So once we go beyond the looks part of it, how tall or how fair or how dark or what is the body type, then only the actual pleasure can be experienced. It is a intermix of neurobiological factors where dopamine comes in, the pleasure chemicals kicks in, oxytocin comes in, which bonds the people together. So this pleasure is experienced through the tactile fibers, the sensory fibers. It goes into that. So what we're talking about today, the circuits and to the sensations, right? So from the circuits, it has to be making sense in the brain, and it depends on their previous experiences, how I perceive or how the person perceives this pleasure to be, and what is the definition of pleasure. So there's so many variants for the pleasure to
correct.
kick
I
in.
agree. You're right. You're right.
Right?
Pleasure is not the same, and
This
you
is
can't
not the
even put
same.
it in a line or a sentence.
Exactly.
Even
For
in 5D,
some,
6D, you can't do. You just have to experience it. That's it.
exactly. So
Uh,
for some, taking control is pleasure. For some, submitting is pleasure. So the BDSM concept of it, the kinks part of it. So there are so many variations to how you can tune your brain and then experience pleasure. So the protection part of it, the pleasure part of it, and along with that, the performance part. Now this is a pretty tricky one. Everybody wants to enjoy and have that pleasure for themselves, but the minute that this takes a performance-based approach, then the target based approach. Performance, as a lot of people think, it's not just about how long someone lasts or what is the strokes that you can do. I have patients here, I have to mention this. Some of them can come to me that I was able to do 200 counts, 300 counts, 500 counts. Yes, because they
Are you
want to
serious?
validate. They come with a lot of this. This happens because they are not sure of where they stand. So the
But
mind
why does
wires
this
them.
performance concept actually come at all? Where is this social conversation?
Position.
Where is this going on in the? It must be going on in the market,
It
no?
is,
For
it is, it is, it is definitely going on because one, it is also about your own sexual self-image. And sometimes, yeah, the self-worth is attached to how long you're able to last, and then it can come from various experiences like pornography experiences where they see and then they want to match up to that. So a lot of these wrong ideologies that kicks in, and then there is this bragging thing that can happen with a lot of
ah,
their friend circle, like I was able to do this much, and then they feel like, no, I'm not able to do that much at all, so there must be something wrong with me. Or they want to validate to the partner as well, like, look, I'm able to do that. So it is the performance pressure starts with these kinds of definitions. But instead, if you look at what is a healthy performance, it is more about cardiovascular endurance, the strength and the conditioning, the sync up that you have, the way you're able to calm your nervous system, where parasympathetic activity or the rest and the digest system gets activated automatically, filling up with blood, and then able to feel the entire sensation through the sense organs. Then the performance of all the internal aspects going as one. So that should be more of a performance, but
exactly.
instead, people think it's more to do
They're
with
putting
how
a
long.
number. They're
Yeah.
putting a number to it, or a time, or some number, crazy number.
Some studies that we can think of, right? So, research studies and those situations, and I can understand if somebody is part of that study, why the timer is used. But using a timer regularly in bed is actually a huge problem.
So one of the first myths that Dr. Shivadev is breaking here is performance is not a number. Achieving pleasure or giving pleasure is not a number. It's an experience, and it's qualitative and not quantitative. Correct? Yeah.
Absolutely. Absolutely. It is
So, and
about the experience.
sometimes you may get the same pleasure in 10 minutes. Sometimes you may take the same pleasure in 1 hour. Sometimes you may do it for an hour and get no pleasure. So it makes no difference if you lasted 1 day, 1 week, 1 month. It doesn't make any difference, guys, because the end point is not the number of hours you have lasted, number of strokes that you have done. It's the pleasure that you
Pleasure
have
that
got
is
at the
there.
end of the day. That's the bottom line.
Anecdotal incident here that I want to
Sure,
mention.
sure.
Some of them come and talk to me because they don't necessarily have a problem, but they end up in my center because, sir, my friend told me that he's able to do 3 rounds, 4 rounds. But I feel after one, I feel happy with it. So, but because they were talking about these things that 3 rounds, 4 rounds, is there a problem with me? So that is when education comes in. There is this refractory period that we talk about post resolution and post orgasm. There is this refractory period. So whatever the amount of stimulation that you want to give, it may be varied. Some people may be able to do in 30 minutes or 40 minutes. But my question to them is, why do we even want to do this in a second round? The first time, if it's an experience, you don't look at it as a performance pressure and all that, you'll be more than happy with it. And then satisfaction is more important. The union and the way that you feel with each other becomes more important.
So I think I want to again say something and get a validation from you on this. Point number one, to say this 3 times, 4 times, and all of those things. Easy telling the truth? First question.
True.
All of us know we exaggerate.
Hmm.
ನಾವೇ ಸ್ವಲ್ಪ ಮೀಟರ್ ಹಾಕಿ ಹಾಕ್ತೀವಿ ಕರೆಕ್ಟ್ ಅಲ್ಲ ಫಾರ್
Agat,
ಎನಿಥಿಂಗ್ ಇನ್ ಲೈಫ್
agat,
anything,
agat,
you have
agat.
done two investments, you say four investments,
For
we make 100 rupees, you
investments.
make 400 rupees.
True.
Everybody is known to exaggerate just to show. So normally, this feeling of not being good, or the negative thing, you try to supersede it, or put an icing on it to show that you are a superman and things like that. So first thing, guys, we don't know this telling the truth. But let us accept that he's telling the truth. The fundamental next thing that as we go through, we will explain to them, and just want to bring it here because you said that, was this 1 time, 2 time is an orgasm, technically, because the end point of one sexual experience is an orgasm. Now, many people don't know. I have encountered that the way a man gets an orgasm and a woman gets an orgasm is very different. Very different. And man, it's one organism, and then, like you said, there's a downtime. And that's where the problem is. And the woman many times is not happy to an orgasm, they need multiple orgasms. Am I right with that whole? So you have to then understand how to get the woman multiple orgasms before you get one. And that's the way you plan it. If to probably that's one of the ways of
I
planning
will,
it.
I will, I will also come to that. Yes, please. I'll
Yes.
let.
So anyway, so
Yeah,
that's my understanding.
true.
So I think we have jumped into this. Let's start with this. No.
Very true. Because
Yeah,
this
let's
is
start with this because that's the
the
end point. Let's
perception.
start with the end point and then go backwards
The,
from there.
true. orgasms are the ultimate result of something, is a lot of people think, but they forget that there's so much of pleasure from the start.
Correct.
I talk about it to my patients also, saying that even when you start getting dressed up, it's a foreplay. Correct. You start going out for dinners, you start doing all of that that you do before that. It is a foreplay.
Even the perfume is a foreplay.
Foreplay. Because the sensory organs, the way that we stimulate that, it is a foreplay. So the beginning of it, if you consider like that, and then you go out for probably drinks or dinner or dance or something like that. So there is a lot of physical intimacy that starts with that. It starts building.
And the build-up happens.
Build-up is of the positive sexual tension. So all of these things that start is priming the brain to
Yes.
feel that. So it's like a lot of people think like, come in, lock the door, then you start performance.
Correct.
People who
It's
are
like
doing
there's
that,
a ram bam, thank you, ma'am. It's not
wham
like
bam,
that.
thank you, ma'am.
It's not going to happen.
And for a lot of people, they think that is actually there, and then they start counting in bed. But instead of it, if you just change the perspective of how this is a continuous process, we can understand that orgasms are actually only in the end.
Correct.
It doesn't even have to be that. The entire process can be pleasurable. The kissing, the hugging, the intimacy part of it, right? So if you consider
Even just
this,
holding the hand and squeezing the hand can be good enough.
absolutely,
I agree
absolutely,
with you.
the glance,
Yes.
the eye to eye
Correct.
glance,
Correct. I
the
agree
eye
with you.
teasing, the communication that
Yes.
you can
Yes.
do by
Yes.
just looking at your partner,
True.
and the meaning that you kind of establish
Yes.
with her.
Correct.
It is so exciting to the
And how
brain.
the build-up is happening
Build
with
up to
that.
the brain
Yeah.
is amazing. So in this context, then second round, third round, fourth round, as you rightly mentioned, there could be like, because of the bragging rights, they want to show the alpha male,
Correct. Alphabet.
right? The alpha male, like I'm the one who's able to do that. And having this kind of a partner in adolescence, especially if you have a girlfriend or if you have a boyfriend, it is also like, you're somewhere more superior, and you're able to get that. So this kind of a thinking should be derailed, should be discouraged, and we should not really go behind these multiple times. I also ask my patients, do you know, probably he has an early ejaculation problem, because of which he finishes early. Then he is forced to go into the second round, third round, probably also because he wants to satisfy the partner, right? If you're able to do it for an extended period and enjoy that, I don't think both of them would need that extended rounds kind of an approach.
Absolutely. So you use the new word here called foreplay. So I'll tell you why. Again, I was smiling when you said foreplay. So I share the theater in Jain Hospital with the vascular surgery team. The head of vascular surgery is Dr. Vivek, and I've done a podcast with him on vascular health. So every time I walk into the changing room and Vivek is also there, case start aita. Have you started your case? He'll ask. ಇಲ್ಲ still we're getting ನಿಮ್ದೆಲ್ಲ foreplay ತುಂಬಾ time ಆಗತ್ತೆ. Because we neurosurgeons take so much
So
of
much
time
time
to
to
set up
prepare.
the patient, to prepare and everything else before we actually put the incision. From the time the patient is on the OT table induction to the time I put my incision, sometimes in an hour and a half.
True.
So he says, ನಿಮ್ದೆಲ್ಲ foreplay ತುಂಬಾ
Foreplay
ಜಾಸ್ತಿ.
ಜಾಸ್ತಿ.
So he constantly uses that phrase. So
And
every
also
time
extended period, no, for you guys.
yes, exactly. So so to drive the point home, one of the other things that I've realized is women, love foreplay very much. That's when men somehow don't understand the concept of foreplay. Many people, I think that's where.
That
So many
definition.
times you have to give the distinction between what a man thinks, what a woman thinks, and
Absolutely.
what the man should know what the woman is thinking. The woman should know what the man
Man
is
is
thinking.
thinking.
Unless guys, both of them understand each other and
True.
set each other's expectations and then do it, I think this will not happen.
There is this book also, I think, from earlier days, and then also men are from Mars and women are from Venus.
Correct.
So it is to explain that the way that women and men think can be completely different because of a lot of wirings.
Correct.
I want to bring in an evolutionary concept here. Suddenly remembered it, so I think it's irrelevant. I will also answer what you asked me later. The evolutionary concept which I want to bring about is the mating ways, right? How a man tries to mate and how a woman is trying to mate. The mating strategies are very different.
I see.
Because it is also understood that the cost of mating for a man versus the cost of mating for a woman,
Very different.
yeah, is very different.
Very
For a
different.
man, there's no cost.
Correct.
Actually,
Correct. I agree.
evolutionary, because he doesn't carry the
Agree,
child,
baby.
he doesn't
Correct.
baby
Correct.
and nothing to do with
Correct.
it.
Correct.
So
And
the
doesn't have to nurse
mate
the baby also
choosing
later.
strategies, and also how many partners that the male has to go behind to actually get that acceptance, also comes from the fact that the woman is very choosy and picky about the partner, because not only that the woman wants to
Very
enjoy
interesting.
that.
You're very true. It's so true.
The woman also wants to make sure that I am going to be with someone who's responsible, who's going to be with me, who's going to be providing me safety,
Correct.
security, the basic needs. Now, I'm not
Correct.
talking only about the modern world.
Correct.
Everybody
Correct.
is,
Understand.
by itself,
Psychologically, it's the same.
psychologically.
Yes. Yes.
Not
I
about the
agree.
woman is
Yes.
able to do
Yes.
everything by herself today, but I'm talking about the psychological needs here, right? The safety and the security is not there. So, you impregnate and you're not there tomorrow, then the cost of mating is very high. So that is why they're very picky. They tend to say no, whereas a man tries to, ask
Yeah, and
many
for them,
people around.
it's like on level. If
Yeah,
he's slept with four
yeah,
women or five women,
yeah.
they think it's a big thing.
Unfortunately,
Stupidity
they
that is.
they
It's, I
don't
think it's a
understand the
not.
concept of how this is. That is when the balance is off. As you were talking about Kama Sutra, the Dharma, Artha, Kama, and Moksha. You just look at one part of it as Kama. So Kama Sutra, as you mentioned, has always been encouraging us to think about this as a holistic concept where you understand what is your dharma there, what is the duty that you need to follow. And Artha is the material security. And I also want to add on, the Artha is also the meaning that you give to this experience. What is the reason? Why are we trying to do what we do? Because we are evolved, we can think. Why
We have
don't
the
we
frontal lobes
put,
that develop well.
exactly, why don't we put that to use? Right? It's also about two people here, not only about, satisfying your needs and
You
moving
can't.
on
It
with
can't. You
it.
can't work on an animal instinct.
Exactly. So we need to know, that is where I think we can talk about that later,
Correct. Sure.
where affairs and dating and all of that. So that part is very interesting as well. I want to touch upon that there.
Got it. Very interesting. So it's evolutionary. It's a very valid. I think that sets the context of people understanding, what it is, and then you should revisit and see whether most of the people think the problem is on the other side. The problem may be with you. It's the way you are
It's
approaching this whole
mutual.
relationship.
You
Huh?
need to have that introspective
Exactly.
abilities, right? So
Exactly.
what am I bringing into it and what is not? And if you don't get that, then the meaning is lost, and the four pillars
It
are
just
not
become a
there.
transaction. It can't be a
It can't be a barter
one night
system. It
stand
can't be
transaction. No?
transaction.
Yeah, it can't be
That has
transaction.
its own meaning, but then you need to figure out, what am I getting out of this and what is this giving me in the long term without a proper meaning. You could be chasing something and you could get satisfied, and the number of body counts, that is also very important. There's a high level of sexual dissatisfaction today because of multiple experiences with multiple partners, and the chasing and the availability of the technology for people to connect, and all of that has become at an all-time high. So they're not able to find the satisfaction with certain
I think
sexual
they
life.
don't even know what they want probably.
Exactly.
Don't you? Do you think so? Have you seen patients who come to you who don't even know what they want, and probably why is that? Why is that happening in today's age of 5G, 6G, YouTube, this tube, pornography is there, this is there, everything is there. Why are people still struggling?
Because the definition keeps changing for them. They are not aware, they are not rooted to what they want, because there is this inherent confusion about them, and then the dopamine reward chasing pathway.
It's all the
So
short
you
term,
get
two
that
minute Maggie noodles type.
instant gratification.
Instagram.
Instant gratification. I don't get something in 5 minutes, then I'm upset.
Mm.
I'm constantly tracking. So
Look for
this
something else.
concept, when they get there, the way that the value is attached to this is different in some people's brain. The value is attached when I don't have it. The minute I get it, the value is appreciated for a small time. And after that, the value reduces, and then there is no value. And then I'm chasing again. I'm chasing again. So, in this kind of context, it's pretty confusing for them also. So, that is where we need to look deeper. What is that you're trying to fill up here? Because people have sex for so many reasons. 237 reasons why people have sex. There's an article by
237.
there's a
Huh?
article. There's a scientific article by Meston and Buss.
Uh,
So I think if people are
Interesting.
interested, they can read up about
Sure,
it. It is a
we'll put it up. Yeah.
clinical study that was done with many reasons,
Uh,
many reasons. So utilitarian reasons, barter system, so many reasons are there. So that is also one of the articles which talks about the evolutionary concepts that I spoke about. So they have to know what is it that they want first. They need to know themselves. If I don't know myself, if I'm not aware of my own identity, what fills up my identity and what I want, what I'm, worth, then I could be chasing something.
so what I was getting as you were talking about this, what came to my mind is, I have read, I have heard, I've seen people say, that the man and the woman go on a date, and the boy wants to get into the bed as soon as possible. He seems to be having that as one of the primary agendas as a positive outcome endpoint. The girl doesn't want to get into bed until, like you said, the evolutionary thing of, is this the right guy? So I've heard this. I didn't know there was an evolutionary connect with that, but I can see this very, very clearly. So I think that's why women are not liking these some of these guys, and these I don't think the movies are making anything any better. It's in fact it's making it work with this alpha male attitude and all of those things, six packs and this walking around. People think that if I walk around like this, every woman is going to fall like this. Nobody is interested in physique. Don't you agree? After a particular point, around, no woman is associated with your physique. They want upstairs. They want you to be a good human being, a good man, a very sensitive guy, emotionally connected. That's what. What do you think about that?
Absolutely. I think that's where we started off this conversation, that it's not only about the physical appearance or the looks and all of that, which you brightly brought in. It is a holistic way that, they need to understand as a connection matters, and different people have different things. So it could be like, for some people, for demisexuals, for example, love and connection is very important for them to have sex. For some people, if there's someone is a sapiosexual, intellectual stimulation is a must. You could be good looking, but if you're not able to make sense and understand what we're talking, then I don't get sexually attracted to you at all. So many reasons why the man and the woman comes together. For some, the sexual motivation or the motivation itself for that relationship could be sexual. For the woman, it could be about not feeling lonely, wanting to have that connection with you, taking it slow. So we need to understand where we are and then have conversations. The problem comes when there is no communication. And you could have heard about it. And I think there is a lot of things where they enter into a consensual sex, and then next day the woman feels that it was not consensual. So many cases have been
Really?
registered. So many cases have been
Cases
registered
means in the police
in
station.
the police station. There is
What?
already a lot of things. So because this is the confusion about, I think they would have gone out for a date or had alcohol, or even without alcohol. But I want to mention that it is a state of mind. In that particular point, you may have said yes, and then there's a lot of confusion that can come later, especially if you're inebriated. So I think if there is no proper communication around it before, during, or after, consent, protection, so important. Both could be right, both could be wrong. We're not judging here or not saying what is right and wrong, but just bringing in scenarios for discussions which are so much of gray areas. Without knowing these things, you could just land up in a problem unnecessarily, where communication could have solved it. You want to do this, you don't want to do this, you want to try that, you don't want to try it, maybe we should do it later. Be okay with that. It's not about forcing someone into that aspect, and somebody may say yes at that particular point of time, being vulnerable, but the effects of that on their minds is not, it's not going to be a very happy situation there.
So the follow-up question to these so-called cases you said is, I am assuming the way you said it is more woman putting the case than the man. Is that, or is it both ways?
That is what is coming to the legal system, but I also know of so many men who are involved in such relationships where they are actually trying to be with the woman, but it is more for the woman rather than only for the man. So it
Come again. I didn't. I
because
didn't.
like how a woman is putting the case on the man, that what we spoke about, but the legal part of it is what I mentioned right now, because whatever I'd seen in papers or what comes up, and especially because of so many dating apps, there's a lot of people where there is a scam going on, where they are posing someone as a partner, and then they're taking them to the restaurants, and they have a certain restaurants where the restaurant guys also know that this woman is bringing there, they order expensive this thing, and they take a cut. That is also there. So we need to be very aware of how much of technology we're using. And otherwise, I also know of a lot of men who have told me, and then there is a particular person who comes to me also with these kind of situations where he's in a relationship more from a giving perspective. He doesn't want to break off, but he doesn't like the relationship. He's trying to do it only for the woman,
Oh, he doesn't like the relationship,
enjoyment,
but for her sake.
but for her sake he is continuing the relationship. So these are also the situations, but it's not about consensual or unconsensual here, but the way it feels inside his brain. He may not always be happy with it. I told him that it's important he gets clarity, draw boundaries, communicate. Again, these three things: clarity, communication, and boundaries, and informing what you like and don't like, even if it causes a lot of fear inside you. Fear of abandonment may be there, or I am feeling lonely, I don't know who else I will get. These are all not the things. So please realize what we want, and then take the proper communication and approach to this. It can save lives, save legal problems. So many complications that comes at the society level, legal level, can be avoided.
So what I'm getting from what you're saying is, the relationship does not have to be always having a sexual connotation. It
Absolutely
can
no.
be just a good bonding, a beautiful relationship with another friend. So they can even change the the relationship
Equations
to
based
the
on that.
equation again through communication, so that maybe that's all the lady wants,
Yeah,
that's all the man wants, and
yeah.
then he doesn't have to be unhappy, he doesn't have
Yeah,
to be doing it for her, that he will also
yeah.
get benefit, and everybody,
The
both
unsaid
of them.
stuff
Yes, his
should be said.
words correct. The unsaid stuff should be said. I think that's a very simple way that you have put it at the end of the day. I think brilliant. A lot of people mistake as an extension of this what we are talking is the act of sex as itself is lovemaking. There's two so different things. So you did speak about the whole process. So is there anything additional that you want to say about this whole process of how that whole thing gets built up and things like that, so that people get
Few things that we spoke about. The love making part of it is also about the excitement building and the priming that we spoke, right? So, act of sex is only about the physical aspect that you get into that, and then you start doing the foreplays and penetrative sex and all of that. But aesthetics, partnership, preparedness is spoken in Kama Sutra as well, where you have to be about the gentle genital hygiene part of it, the other things that we spoke. I think it's a combination of so many factors, such as preparing yourself for the partner also should be joyous, and the lovemaking part of it has to be about also the playfulness that you bring, the kind of enticement, persuasion that you do, the waiting for it. So many things are in the love making aspects of it, are not only just directly physical, the persuasion part, the tension that builds, like, when you're pursuing a partner, the partner's in between saying yes, saying no, and
don't
you're
force yourself.
pursuing.
Yeah,
Yeah, you should not force yourself. The pursuing part of it is also an exciting thing. So the love making has so many aspects to it, not just the physical intimacy, how we reduce it sometimes to only that act in the bed. So, lovemaking versus pursuing versus enticement, playfulness, the amorous relationship, the foreplay part of it. I think the waiting game, the consent game. I think it's a beautiful way in which there's a lot of neurochemical explosions that happens in the brain, and the reward is got. It is not instant gratification, but also building up the tension. Like, I could compare this to a techno song, if I may, because if you understand how the techno or the house tracks are built, there's a lot of synths and a lot of pops, and then there's a constant build up, and then comes the drop. So anything that comes after a long, periodic, repeatable, sustainable tension, and then there's a drop, you could listen
the
to any
kick is
techno track and you
correct,
can
correct,
understand how the brain is excited with long waiting, not only instant gratification. So we need to be aware of it. Love making is an art.
correct,
It's not a science, and some people don't get that. So they will go to the book. Okay, I need to do that, and then they start doing it.
correct. Like me.
I've had situations. I've had
Really?
situations where couples, and it is true, because some personalities, right? I want to talk about that right away, because personalities, who we are in our personalities, has got a lot to do with how we express in sex.
Sure. Give us some
It is
examples.
not true, because it is not true for all of them in the same page, right? So if you are a perfectionist, like I could, without going into more details, I could look at it as broad two categories: harm avoidance category, novelty seekers.
Harm avoidance and
Harm
novelty.
avoidance,
And novelty.
novelty seekers. So novelty seekers are someone newness, hedonistic, indulgence, pleasure, they thrill seeking. So this is on this side, and the
So they
others,
want something new all the time.
yes, this is on this side, and then the others are harm avoidance. They don't mind not having these experiences, but they want to be, like, running behind it, or sorry, they want to go about the harm avoidance part. I don't want to get into risky situation. I want to be safe. So for people who feel harm avoidance is high, the threshold for pain also is very different. The way emotional as well as physical pain. So somebody who wants to avoid harm, they are not very forthcoming. For them, sex is very transactional. Sex feels like, okay, it's a part of my duty. I will do that. We look at procreation. So indulgence part is not there. The head on
So
is,
many of the
so many people
husband-wife relationships can be like
can be
this.
like this.
Huh?
So
Huh.
when somebody is very devoted to work, very strict, meticulous, studious, does everything on time and all of that, sometimes the brain is not so open to the art, the music part of it, the expressions, the creativity part of it. If that is not so much there, sex becomes
It's like
transactional.
bega bega ba, my
Yeah.
you say you come fast, I have other things to do.
Transactional
You
part,
can't
right?
do it
So
that
they
way.
look at it only
Correct.
as a duty. So in the four pillars, they're doing it as a dharma part. Where is the karma part? So for people who are here, right? So if they're not mingling, or one person from here, hedonist, or a novelty seeker is here, harm avoidance is here. So their narratives are very different about sex. So this person wants a lot of it, and this person says the desire mismatch part of it. All of that comes in later. So harm avoiders versus novelty seekers. If you understand, sex feels very different for them.
I mean, why I'm struggling for the right words is, before it was, I don't know, it was an unwritten word. Some of us understood it. We did what we did right way. I'm not sure about how it worked. Maybe we were lucky. I don't know what it was. But by saying all these things, if people start evaluating, am I here? Am I here? Am I here? Am I here? Are they actually now, getting themselves more confused, more into a box? Are we helping them or are we doing that? What do you think? And what's the other way to simplify this whole thing so that they don't get obsessed with these terms and all of those things, but just understand how to participate and how to make it happen and how to give it time. So most of the times, I think you should give it time for the. Sometimes they themselves may not know, what kind of relationship they are, what kind of personality they are probably.
Yes.
What do you think
I
as a
always tell
psychiatrist?
them to figure out themselves first. So
You tell
whenever
them
they
that.
come, right, when the couple comes in, when they have a desire mismatch or the one of the partners saying the person, my partner, is not even initiating, there's a lot of distress that they go through. They're crying silently. They're not able to talk about these things. The psychological stress, burnout, and being in a constant sexless marriage or unconsummated marriage is really huge for them. So, that kind of a situation, we need to understand that when there is a mismatch, when it causes socio-occupational dysfunctioning, it could be like normalized also. Whenever there's a stress, whenever there's a dysfunction, that is when they should seek help immediately without even thinking twice about it. But to simplify it, as long as you are happy with it, partner is happy with it, you're having sexual satisfaction mutually without how many times we do, or it's not even about the number of times, that frequency and all of that, or apart from all of that, if satisfaction is there, then they should be figuring out that we are good enough, giving them time, learning about their bodies, learning about their personalities, especially if it's an arranged marriage or even in a relationship. Sometimes people may not get into a sexual relationship just emotionally. Then once they get married, right, they have to give themselves time. I call it more of learning, or there is a learning phase. There is a trajectory, learning phase in understanding each other, pleasurizing, erogenous zones, what works for you, what doesn't work for you, what you're willing to do. So without getting these things, I think you shouldn't call yourself as like I'm having a dysfunction. So say that I'm learning, I take time to learn, and as we do more familiarity with it, or as we get more familiar and more practice with it, then a lot of them fall into place. If they come in early, then they could be calling themselves as having a disease or a disorder or a dysfunction. If they give time to explore with the kind of mindset, it could be nothing at all. So people have to understand what these things are, and then they can figure out if they need help or not.
Are you telling me, or can I ask you back, are couples coming in too early, labeling themselves as a problem and come in without giving themselves time to adjust? Is that also happening?
It's a
I'm
fantastic
quite
question.
I'm quite sure that that's happening prematurely, putting the psychological stress on themselves and not giving themselves time.
It's a fantastic question. I have I have a spectrum of things here to say. I have people coming into my clinic where should I get married or not? From that
Oh,
side,
from that end.
from that end, should I even get married because I don't think I'm confident enough? And then there is a lot of psychological distress because of maybe the way that they feel about their bodies. They're not good enough, or they try once or two times and then they're not happy with it. Versus on the other side, I have people in marriages for about 15, 16 years plus, not even had penetrative intercourse once.
Really?
Unconsummated marriages. There's a lot of stigma around
My
it. The
goodness.
taboo is real. The distress is real. Silent bedroom or silent divorce or a dead bedroom syndrome, unconsummated marriages, all of these terms are known to people these days. At least they're getting awareness and then they're able to come. So it's not that it's too early. Sometimes it's too early. I have people coming in within a 15-day period. Recently there was this news, I don't know if you're aware of it. I think it just came in a week back. After the first night that they went into bed, right, the girl goes and complains saying that this guy is impotent, he is not able to satisfy me, and I want divorce, and 2 crores of alimony from it.
2 crores?
2 crores of alimony from him. One night. So that is what I was talking about. Give
Good
yourself time.
grief.
And he says that I'm not even emotionally connected. So sex could mean very different things. How it comes is very different. For some, it's about emotional connection. For some, about performance. So there is this loss that they experience, right? So before, the thing is that should I get married or not? Immediately after a month of the wedding, coming in to check, what's happening and not, or even being 15 years of marriage or 5 to 6 years of marriage, whether not even having sex and then not even seeking help, and 3 to 4 years, 5 years gap, there are this certain set of couples where they have not had intimacy, but when it comes about the baby making process, right, procreation,
Is this unique to India? You've been going
It's
across the
not.
world, or is it the same phenomenon across the world?
Fantastic question. I want to talk about this, please. This is where a lot of my patients will ask me, sir, is it more in India or not? Because there is data all over the world. It's not that unconsummated marriage is not happening only in India. It is there in the Europe. It's there in US. Even when I was there in the European Society for Sexual Medicine, we were discussing, because there are a lot of people from all over the world who have come for this
So
fellowship.
it's not a cultural
It is
thing.
not only a cultural thing, South Asian, or it's not just an Indian thing. It is also there because of so many other differences, because the emotional connect is not there, or
So
sexual
fundamentally, everything
dysfunctions.
is emotional connect.
People have fears. As long as we are human beings, we always have some or the other fears going on. How we address those fears, how we overcome those fears, are most important here. If they are not willing to talk about it or not willing to address, it could be not to do with only Indian context at all. It's not at all about the Indian
Interesting.
context.
So it's a ubiquitous problem and not unique to India.
Absolutely.
So it actually, when you a little more things on foreplay that I was thinking is the body odor, the mouth odor. A lot of people have complained about all these things.
Yeah.
So because people don't pay attention to all of this, they'll be smelling of sweat. They don't have a shower and come. I mean, why aren't people not in fundamentally understanding all these things? Where is the problem? You tell me. I
You
mean,
could think of it as lack of sex education or understanding, or even generally as a person. It's very important for all of us
don't you
to
think so?
maintain hygiene.
Yeah,
So what we were speaking about in the protection part of it, if we
correct.
go back, we keep going back to these things
Correct.
because
Yeah,
they've
that's
started
it.
fundamentally
Yeah,
that is
there's
the
no magic
case.
here. It's all
Exactly,
fundamental.
right?
It's the same things.
So, but in this context, I think the preparedness, that is where Kama Sutra talks about the aesthetics part of it, preparing yourself, washing yourself up, and aphrodisiacs, and eating, and the aroma part of it that you want to
Correct.
create, the
The
lighting
lighting.
that you want to
Yes,
create,
yes.
everything adds up to the sensual
Correct.
experiences of the
Correct.
brain. The
Absolutely.
explosion happens here,
Yes,
right?
exactly. First, it has happened
First,
here.
it has to
Only then
happen
it
here,
travels
then it
down.
goes here.
Exactly.
And even
I
if the
agree.
explosion is happening somewhere down
Here,
in the
here,
pelvic
here.
areas,
Ah,
the final explosion
yes,
has to
only
make
here.
sense here.
Absolutely.
Without understanding of that, if you're just looking at, so the preparedness part of it is very important. The body odor, the way that it's, because if you see, the sex is a sensory experience.
Correct.
Anything that goes through the sensory organs is what the brain
And
makes sense of
multisensory.
it.
Multisensory.
That the brain has to integrate that.
Correct.
If at all everything is going fine, that you suddenly get an off-putting order, it switches off.
Correct. Instantly.
Instantly switches off.
Instantly.
And I have cases where bacterial vaginosis, when women with bacterial
Correct.
vaginosis, the partners are not able to communicate. Coming back to the same thing of communicate, talk it out, what is unsaid should be said, fix it. See, simple problems like these, they come with erectile dysfunction diagnosis with themselves, like searching, this is erectile dysfunction, not. So very pretty straightforward, simple things, where it could be bacterial vaginosis, it could be halitosis, it could be bad breath. Some people can have, as we understand, like increased sweating, so they also feel
Body
awkward
odor,
about it,
especially
and
under
body odor, all
armpits.
of that. So preparedness, wash up before and wash up
Yeah.
after. Washing up after saves yourself from a lot of UTIs, and cleanliness and hygiene.
Just going to
This is
come to
very
that.
important aspect of sex. I think
That's,
this should not be disregarded, but people take it personally. I have had patients when
we tell people
come,
to wash their hands before eating food.
right? So it's the same thing, right? Before something you wash up, and after
Yeah,
something you wash up,
yeah. I
right?
mean, what is so complicated in that? They're so stupid, guys. The commonest thing I hear, Shudev, is post honeymoon UTI,
Honeymoon cystitis.
honeymoon status.
Yes.
So many women come with urinary tract infection after, and the moment they say that, I have a smile on my face, the rest of the yo papa papa they're going. We know everything. It's so stupid, and you the first penetration this happened. Then the rest
Yeah.
of the honeymoon is also screwed up.
Yeah.
End of the day, they go to have pleasure. Then nobody is
Correct.
enjoying. She's having fever. They're going to hospital. Oh, yo,
Seven
they went to
days,
hospital.
8 days of
What
entire
a
booking is
what a waste, no?
unfortunately
They
gone.
just and today you have YouTube, you have everything at your fingertips. You can learn all these things, no? Why are people watching useless videos and not useful videos?
Useful
They don't have
videos.
to ask you and me.
Yeah,
They
yeah,
can go
absolutely.
themselves and
Absolutely.
self-educate, no?
There's a lot of information
How to
available,
have
but the right information is
yeah,
important.
how to have take care of the cleanliness is
Cleanliness part of it,
yeah,
hygiene part of it.
yes, hygiene is so critical.
Because if at all an infection comes in, the pleasure part is gone.
Exactly, and it'll hurt, it'll
Hypersensitivity,
pain, so
pain,
many things.
discomfort.
Yes,
25-30% of women have a condition called as vaginismus.
correct.
Again, the most underdiagnosed problem.
Oh,
And also, we diagnose, or a lot of times I've diagnosed vaginismus when the male partners come with erectile dysfunction. Then I look into
Yeah.
him, everything is okay.
How is that connected?
Because sex is about two people that they're trying to do, right? So if we treat only the person who comes to us just because he has come
Mm.
without taking a complete history or understanding the dynamics between the
Mm.
couples, when I've called for the partner to be coming in, and then I always do that, I call them both
Mm.
together to
Mm.
understand what's going on, right? Expectation setting, so many
Correct.
things.
Correct.
So 30% of women may have a automatic pelvic contraction. Harm
Uh,
avoidance, what I was talking about, that pain perception,
mm.
harm avoidance.
Because the first couple of experience they
Yeah,
must have had that.
and also high sense of control. With certain personality, it's common. People with anxiety, obsessive compulsive problems, so they have a sense of control. So whatever from inside the body, urine is passing out, pelvic is relaxing, stools are passing out, pelvis is relaxing. Anything comes from outside, it is guarding, excessive guarding. So this causes a lot of erectile dysfunction. So it is important to also discuss the anatomy of the body, understand your own physiology, know your body. KYB is a very important aspect that I
KYC.
KYB,
KYC. KYC.
KYC, KYB.
Oh,
Know
KYB,
your
KYC.
body.
Know your
Know your
body.
body first, like how it works, what it works. So if you jump to conclusion too early, you are diagnosing yourself wrong and sitting on some problem unresolved, hoping that it will somehow resolve after some point. A lot of people also do that. That is also not the case. So wait for a reasonable amount of time, communicate again. Should we seek help? So all consultation doesn't mean that somebody is going to start you off a treatment, especially in sexual health. Sometimes I tell them that there is no medicine. You just have to understand
Yeah,
these
it's
things, try it out, give
exactly.
them tips, and then they're happy. So instead of trying some Viagra's or something because a friend used, very common again. Go to the pharmacy,
Mm.
OTC kinds, somebody
Correct.
gets it or a friend gets it. So then they feel like that, sir, I used Viagra, I used Tadalafil, it didn't work.
Mm.
They're even more distressed, thinking that there's a deeper problem.
Mm.
The problem is something else,
Correct.
like off-putting odor. This is happening,
Mm.
or something else. And if you look at the mind, one of the most important thing is there is a condition as a subset of obsessive compulsive disorders,
Mhm.
which is like repulsion to body fluids. Some people can have a sensory overload.
Really?
Yes.
Oh, this I hadn't
They can
heard of.
have a sensory overload in the brain. Their brains can be very specific to a certain sensory overload.
Mhm.
And if at all it senses more, and repulsion to body fluid, repulsion to sticky substances, the way that the brain feels when there is vaginal fluid or semen or something that comes, it gives a repulsion feeling. Technically, cognitively, they know they're not supposed to feel this, but it is an automatic response. They don't know
Then
what to
how
do
do you
with
deal
it.
with that?
So it is important that we need to educate, therapy, ERP. There's a lot of things which are available to rewire the brain, like how you are rebooting the
So,
brain,
so it's
rewiring the brain,
so
restructuring that.
rebooting the brain for sexual
Rebooting
health.
the brain for sexual health is exactly what we do.
Interesting.
It's
Great.
without that, no
Oh,
medication alone
this,
can take care of
of
it.
course, it can't. Of
It
course.
can't.
So I didn't realize it is all these additional dimensions are there to this whole thing. But what you're saying is so important. Coming to the physical aspect. But I think because the physical aspects is the easiest thing for us to deal with. Honestly speaking. Yet
Absolutely.
people do not pay attention. Even the urgency to penetrate, they do it the wrong way. They hurt the woman. They hurt themselves in the
In the
process.
process, frenulum tears,
Yeah, so
phimosis,
many. Some of them even
pain
had a fractured
perceptions,
penis at the end of the
fractured
day.
penis.
It's
Yes.
crazy, and they don't understand. So why are people? I mean, is it so? I mean, I'm just trying to understand.
Yeah,
Is it
yeah.
so difficult? Is it such a complicated action? Because procreation is fundamental to the human being, even before the neurosurgery and psychiatry and mathematics and everything came in. Why is that such a difficult situation?
Yeah, it is
What's your take on
because
this?
there's a lack of proper sex education. Nobody's talking about it. Like when kids are growing up, how many times is anyone talking about that? How many times has someone educated? With men, I want to mention this as well because I see this quite commonly. A lot of men, I don't know if you'll be surprised, a lot of men
Mhm.
don't know that they need to pull back their foreskin.
Really?
Yes. Clean that area. There's something called smegma,
I was
white cheesy
just going to
material,
tell that.
right?
That's my next question would be.
So they don't know that. And
My
the first
goodness.
time that they realize something like that, that the penis has a foreskin, it has to come back, is when they try to participate in penetrative intercourse. That is when they have like this hypersensitivity because balanitis is there, inflammation is there, uncleaned areas is there, and also transmitting infection to the partner versus because it is too tight or sometimes the frenulum could be a problem.
Mm.
It's a short frenulum, it breaks, blood oozes out, first night horror. Somebody with this, it is important to understand how horrible of an experience, how horrifying it could be for their first sexual experiences to be because the initial sexual experiences are a
Can
stepping stone to
can be the
further
foundation for
experiences.
everything else.
So both of them are running to the hospital. Frenulum got torn. There's something that's going on. Fracture of the penis also, especially happens a lot with the woman on top position. So whenever the woman is on the top, sometimes the woman may not estimate it properly, and then in the heat of the moment, lands the pelvis on the penis where the fracture penis happens. So more from that kind of a positioning. So it's important to understand how much of an extent that we are supposed to push. It could give you pleasure, but you know your safe boundaries, know
Right.
what you want to enjoy,
Correct.
and also have a communication and understand these aspects of the body to have safe sex. So this is also about protection. This is also
Correct.
about
Correct.
safety. The three P's that we spoke
True.
about earlier.
Absolutely. And if they don't know that they have to, retract the
Retract the
frenulum,
penis. Yeah. Yeah.
what can happen also is paraphimosis can happen. Then the skin
Exactly.
can get stuck, and that can become an
Yes.
emergency
Yes.
if they don't know
One
about
of
some
the
of the.
important emergency factors in sexual
Yes,
medicine
yes, paraphimosis.
is
No, I was
paraphimosis.
just going to say that it
Yes.
must be the
It
automatic
is one of the
expression.
most important
I
thing
can
because
imagine.
paraphimosis for extended period. I've had people sitting with paraphimosis for about 72 hours plus.
What?
Yes.
72 hours? How did
Yes,
they
I've
survive?
had because it's
They didn't
pretty.
know what to do,
It is
or
there is a lot of stigma and
what?
shame about it. They think that it'll go away or it'll reduce, but they don't understand the band formation has
Correct,
happened.
correct.
The blood is flowing in. The blood is flowing in one way. So they are also they find it difficult to talk to people about it because it's a personal matter. It's a organ related matter, and then this happened during
And
sexual
also,
activity,
yeah, and then
and then they'll be
the
feeling that
man the manhood may be challenged.
yeah, and then even with my own patients, when they come to me, right, they feel that the doctor may also judge. Very important emotion to understand that the doctor may judge. Like, how will I talk about these things? They feel so awkward about these things that this is a basic thing and I should know. Is an assumption that they feel without understanding so many multifactorial or systems have to be involved in sex. They think it's a very basic act. It's a natural act. Why am I not able to do this? So because of which also they feel stigma, shame, even to talk to the specialist. Even though I am calling myself a psychiatrist, not only me, any doctor, psychiatrist, sexual health specialist, they feel like maybe they'll judge. Maybe it's only me who has the problem. Everybody seems to be having sex and everybody seems to be having babies. Maybe it's just me and my partner. It is not the truth.
It's not the truth.
It's not the
It's
truth.
not the truth. It's
It's
not the truth.
important to know that. Similarly, because this is not, I tell my patients, look, this is not a dining table conversation in a lot of households, understandably so. So far, nobody, even when you meet in marriages or any kind of function, nobody talks like diabetes, hypertension is a different thing, but they don't necessarily talk about their sexual health
Of course.
openly about it, right? So just because of this particular perception, because nobody is talking about it, it doesn't mean people aren't suffering. A lot of people suffer. Simplest of the reasons also could be more medical, could be deeper, complicated, obesity, hypothyroidism, diabetes, hypertension related, vascular problems, plus the neurological issues, as you are
Correct.
also aware of. So the previous experiences, the partnership related factors, emotional factors. I could just
Yeah, you can
go
keep going
on
on. No,
with
no,
it because
let's
we have to see sexual health inclusively.
agree. So what we'll do, I agree, Shivadev, that you're talking all these things, but let's go step by step because
Yes.
otherwise what's going to happen is,
Yes.
we'll miss the wood for the trees. So we'll stay with the physical aspects first for some time because we are in the
Yes.
physical aspects. Because those are the easier things to solve. The psychological things will have a lot
We'll
of
have
work.
a lot of
So
dimensions.
first, for the men, we want to tell them, number one, is that you should understand you have to withdraw your foreskin. That is the first message they should understand. So they should
Yes.
test it when they are.
Hygiene.
First is withdraw it. Make sure it withdraws completely. Number two, then you should understand something called smegma, which is a secretion that comes normally. And that smegma can not only cause infection, it can even be a precursor to cancer that we know,
Yes,
testicular
yes,
cancer. We
exactly.
know about that.
Penile
So,
cancers.
penile cancer. So, you cannot neglect that. Whether you have sex, you don't have sex, it just doesn't make a
Basic
difference.
body hygiene to be
Basic
maintained.
body hygiene. So, when you withdraw your your foreskin completely behind, and your glans doesn't get exposed completely, that means there's a problem. And that problem has a solution called circumcision.
Yes,
So then you have to go meet a urologist or a
yes,
general surgeon, get a circumcision done. All this it does not have to wait for the first night. It does not have to wait for the first date. It
yes,
can wait for common sense. And this has to be taught to a child from school time that
exactly.
to know how you have to withdraw, what you have to do, as I said, things like that, and take care of this.
Message to the parents is also that
Yes.
talk to your son about these things, encourage
Absolutely.
them to understand these things,
Absolutely.
because you will save so much of problem if you
Absolutely.
understand where I'm landing or where my
Absolutely. These are
patients are
the
landing.
these are simple things.
Simple things.
And also you have to understand for the man that the sensitive areas is on the glands and not on the foreskin. So the experience is also the pleasurable experience is better than we
Heightened
tried.
sensory nerve endings.
Absolutely. So that's the next thing. So again, for that additional benefit, you have to do that. Same thing with the woman. Personal hygiene is very, very important. And to know that you have aroused enough is when you know the vagina is wet,
Wet.
as you understand.
Lubrication happens,
Lubrication
arousal.
automatic. So you understand all of those things. So this very, very so you can have your own checklist to find out whether things are, if you're not getting aroused at all, then there's a problem there. There's no point going somewhere else at the end of the day to figure it out. I think these are the physical aspects to see, because these personal hygiene issues commonly results in infection. This infection sometimes doesn't go, and even if it
Cross
goes,
infecting the
yes,
partners is
cross
called.
infecting the partners.
Yeah.
And then if it doesn't go, or and if you're not taking a personal hygiene, it comes back again. So you wonder what's going on. Then you get into the morality trip that something is wrong with me.
Yes.
The problem is not something is wrong with you, something is wrong with your personal hygiene techniques.
And
Sim
excessively, another important thing is excessively using solvents and chemicals to wash those areas. Internal vaginal douching, a lot of
Hmm.
people do, or excessively washing,
Why would they do that?
because they feel it's like important to keep it clean.
Ah,
And
so they
because
overdo
they
it.
overdo it, the normal pH balance is lost.
Mm.
The vaginal microflora that's important to
So
maintain the normal aspects of it is gone. And because it starts becoming more worse because of this factor, they don't know, they think it's unclean, they clean more.
so it becomes a
So it
vicious
just
cycle
becomes a vicious cycle. So treatment also means educating them about this. They
of
should
how,
know
what to do and
what
how
to do
much
and
not to
what
do.
not to do.
What not to do. Because from down it will go to the top. So experience from the top has to come to the bottom, and the physical problems from the bottom goes to the top, and then it's a vicious cycle going round and round and round. What is top? What is bottom? What is happening?
It's
What's
the
not happening?
gray, not black, not white.
Yeah, it's just crazy, guys.
Yeah.
See, guys, many times it's just maybe simple things, no, Shivadev, at the end
Very
of the day
simple,
that
very, very
you
simple stuff.
keep the basics right. Then you can actually come to the core problem and only deal with that, rather than when you look at, if you seem to have 10 problems, you break it down,
Yeah,
then
yeah.
you realize out of 10, only one or two needs to be sorted out, and the rest of them is just
Automatically
understanding.
taken care.
Yes,
Understood.
understanding and taking care of it, and that's what happens. So important to understand these things. So we'll stick to the physical aspects for some more time. And this naturally goes because we're talking infection and hygiene and all that. The other extreme of this, especially in people who have multiple sexual partners and especially who go to commercial sexual workers, is sexually transmitted diseases or STD. So, can you educate our people about the risks of STD, the safety precautions, and the do's and don'ts, and the myths and the stigma and everything else?
Absolutely. Because today, multiple sexual partners are on the rise because of the way that people have opened up about it. So it's very important that the protection factor has to be taken care of.
Correct.
I tell
Both ways.
both ways. I tell all my patients, and even otherwise when I'm giving any talks or any kind of sexual health tips that I'm talking about, unless and until you both are very clear that you're exclusive to each other,
Mm.
always use a protection.
Mm.
Doesn't matter if you know the
That's a
person,
that's a
don't know the
good
person, you trust
that's
the
a good
person,
statement.
right? So it's important to know that, because not everybody is openly talking about how many partners that we have had. So what's the problem in using a protection? Some people think of protection as like, I don't trust you, that is why you have to use
Mm.
it. So they feel like to make the partner trust them, they can go protection free.
Mm.
But you look at the consequences. So sexual transmitted disease, bacterial viral infections. So chlamydias, gonorrheas, syphilis, these are on the one end, then HSV, herpes simplex virus, HPVs, HIVs, as we know, so as on the other end. So there's a lot of things that we can prevent. That's the good news. 99% of these things can be prevented with simple things. Condoms, dental dams, barrier methods can be used.
Correct.
So these are very important thing. And even if by accident something happens, there's a post-exposure prophylaxis.
Correct.
Suppose you're with someone, the condom tear happens, or within 12 hours or 6 hours, 24 hours, 72 hours, you can start yourself on a medication called as post-exposure prophylaxis,
Mm-hmm.
where even though you are experience something because something went wrong, you
Mm.
can take a medication and reduce your risk of HIV. So people should know this, because it's not like everything is doomed.
Correct.
I have a lot of patients who come to me when they want to indulge in multiple sexual partners. They're attending some parties, or they want to grow into groupies or things like that. pre-exposure prophylaxis is also available. Even before
Oh,
you're going into a
really?
risky
I didn't
thing,
know that.
pre-exposure prophylaxis, just start yourself on some medications, make sure that the
Interesting.
drug level is there in a certain level in your body. So when so many things are available, I don't think anybody should suffer from infections themselves and also pass it on to somebody else. So if you already are aware, I think it's a fair practice to say that, look, I have these infections, I think you should be aware of. It's about trust. It's about also the other person's understanding and
Correct.
health. You should not be
Yeah, I
withholding
think we
some
should be
information. You should be
correct.
very
I
open
think
about
so.
it,
I agree with you.
and then only it makes sense for you to indulge with someone. So post exposure, pre exposure prophylaxis, barrier
But
methods.
how? So when you're using this prophylaxis,
Hmm.
how? When I say, is it 100% prophylaxis? And like you said,
Almost 99 plus
okay, so
percent,
it's
because what it does is it prevents the replication of the RNA virus,
uh,
prevents it from
but is
replicating
it only
further.
for HIV or is it
It is
for
mainly for HIV,
only? So
because that
that's
is the most dreaded thing, because the rest at least are treatable.
treatable. Got
HIV
it.
is something that where a lot of
Correct.
people dread.
Correct.
When people come, there's two components to it. As we were talking about infections, I also want to touch upon the other aspect of it, where two aspects is infection component is one thing, the anxiety component. I have a lot of people who have these experiences come to me and then they are dreading it. There's guilt, there's shame. Why did I do what I did? Till that point, they're okay doing it because the reward is there. Immediately after doing that, it could be some of them going to spas, massages. Pretty common. I want people to know that that these things are happening, right? So they have
Oh,
to
with
be
the
extra
masseur they do that.
masseurs also.
Oh.
There's so many things that immediately after that they feel extremely guilt, shame, fear about infection, and then they go through an obsessive compulsive component. So whenever people come, the infection component I treat separately, and we should take care of that, plus the anxiety, because should I do, shouldn't I do, can I eat on the same table as my family, can I put the clothes for wash? So many questions they have, they're bombarded with it. So I think the right knowledge should be made available, right information and content should go to people for them to be more aware as to what is and what is not. That can help them to prevent themselves from these deeper problems.
Excellent. So just to inform our viewers who are watching this video, our January 1st episode is on. I've spoken to a microbiologist on AIDS and
Yes.
HIV.
Very relevant.
Yeah, so go back and watch that episode. We are talking about how what the exposure, what the risks are, and much more than what Dr. Shivadev is and we are talking right now with Dr. Satish Amarnath. So please go and watch that. You'll know what's going on. So we have covered the sexually transmitted diseases. Now, one of the things that people, do not realize, this infection can come even with oral sex.
Yeah.
So,
Yes.
since we are keeping the physical aspect going, let us now talk about oral sex and things like that. And can you educate
Michael
our
Douglas recently gave
the
a
famous,
statement,
the famous
the Hollywood actor,
Hollywood actor?
and
Huh?
then they clarified saying that he had other risk factors and all of that. So, but what I want to point out is earlier a lot of people used to think that oral sex was safe and then you can do it without protection. So that is why dental dams are there, where even if you want to give oral sex to a female partner, there are like dams or things like that which you can use, so that you don't have to have direct submucosal or mucosal contact or direct mucosal stuff. And on the other side, HPV risks are very, very high in people with oral sex. HSV,
HPV.
HPV as
Really?
well. Yes. So there is a certain kind of HPV,
Human papilloma
papilloma
virus.
virus.
Correct.
So
And
the
this
most
this
commonest.
virus infection is a precursor to cervical cancer in women.
Yes.
Yes.
So the HSV, though everybody knows that it's pretty common. Herpes simplex, it can like type 1 spreads
Correct.
through kissing. Type 2 is genital, but that is easily treatable and a lot of people have that. So it is not really such a big deal. But HPV is important to understand and doesn't immediately present itself. There's a specific strain like HPV 16 strain,
Hmm.
which is known to cause that. So it can lead to throat cancers and also
Ooh.
cervical cancers.
Really?
So because it gets integrated into the epithelium of the
Ooh.
throat and then multiplies that and brings in genetic mutation.
My
E6, E7
goodness.
happens,
Really?
which suppresses the tumor suppressant agent so that there is a cell proliferation that happens.
Crazy.
So this is the actual mechanism. And it doesn't even mean that even if you do it today, it will present to you tomorrow. So protection, arm that we were talking about, the 3 Ps, so important for your own self.
Crazy. But then, how is there a preventive way to understand you test yourself before HPV?
It
Is
is
there
known.
something like that, or
Yeah,
is there no solution
yeah,
to
there
this?
is a DNA PCR HPV that they can do, and also The most important
So
aspect
everybody
is
should carry a virology report with them. I don't have this,
I
I
don't
don't
have
have this,
that.
I don't have this latest report.
Or
Like
we
how
can
we get.
just or we can just simplify that, if you are with multiple partners, get frequent testing done.
Yeah.
Once in 6 month testing, please get that done. Feel safe, be safe to others.
So why don't we suggest this? I'm putting it out in the open. If you are somebody who wants to have multiple sexual partners, both ways, all if you carry reports, no,
They do that.
they do that.
Yeah, they do
Good,
that. Some
there you
people
are.
do that because
So give them
they have to build in trust.
correct. So
So
do
they do
that,
that.
and
They do
then
that.
you leave the rest
Yeah,
to
either
destiny,
it's a
God.
communication, and if needed, they test it, and then they're able to prove it. Because the safety aspect, if it's not
Yeah,
there, then the pleasure doesn't come in.
exactly. The pressure doesn't come in.
So they do that.
Though the Kama Sutra philosophy is imbalanced,
Yeah.
but please understand that it's. But still, if that's the path you want to take, that's the path you want to take, and take
Free
those precautions.
communication, open
Yes, yes,
communication,
and
explain.
do the due diligence, as what we say at the end of the day. So Michael Douglas said about that. I remember that very
Yeah.
clearly.
And HPV vaccines are available. So 4 types of viral types can be done. 9 can be done. So vaccination is a very important drive. I think government of India is also taking up seriously. Gynecologists are suggesting to prevent the cervical cancers. Kids between 9 years of age or up to adults of 26. So they can take these vaccines easily. It's available everywhere. So I think one of the most important thing that you can do is this.
So now let's come to one of the other things that you did mention, but I didn't talk about at that time, is ED. ED is not Enforcement Directorate. Okay, don't think it's ED is Enforcement Directorate. It is erectile dysfunction. So can we bunch erectile dysfunction and premature ejaculation together, or are they two different things?
Yeah,
How
we
would you
can.
want to?
No, I think they're very two different things.
Okay, so
But
you
sometimes
can.
they can occur together as well.
Yeah,
So
so
we
you
can
can.
keep that
Yeah,
separately.
yeah. You take a pick which you
Yeah.
want to talk first.
So
Give us
ED,
some examples of some patients who
absolutely,
came to you.
absolutely.
How
So
how does the scenario present? What is a normal? What does a man come and complain to you so that they understand? Oh, this means this. This means not this.
there's a huge distress. Firstly,
Mm.
because they don't come in directly and say that that there's a problem. Sometimes I have patients who come to me talking about a lot of mental health things first.
Mm.
1 session, 2 sessions, and then they
Oh,
start
they come
opening up.
actually for a psychiatric problem.
Initially,
Huh, huh, huh.
they want this to be addressed, but like I told you, there's a sense of stigma and shame. So they don't want to start off with that, and they start with their psychological aspects or anxiety issues, and then they can speak. Sometimes the overdiagnosed guys can come in, like, I did this, I have ED. So that is also there.
Two ends of the
That is also
spectrum.
there. Two ends
Uh,
of the spectrum.
mm.
So most commonly, inability to maintain erections or inability to get an erection or sustain an erection for completion of the physical act. So that is what ED means simply. But apart from that, the vascular aspects are important, right? So the physical aspects are also there. The psychological aspects are there.
See,
Hormonal
everywhere there's
effects
a
are there.
physical aspect, there's a psychological aspect. That's what I'm constantly hearing this from Dr. Shivadev is there's a physical aspect, there's a psychological aspect. First sort the physical aspect, which is simpler thing to do. You may be doing something and it maybe solve all the problems. Because physical leads to psychological problems
It
more
comes
often.
together.
Yeah. So yeah.
Psychological as well leads to
Correct.
physical
So at
aspects.
least if
So
this is sorted out, then you have
yeah,
one problem to sort
yeah.
out versus the which is first, which is second.
Here, I have had scenarios where phimosis was there. They got the circumcision done. Then they think everything goes away. Waited for it for 2 years. It didn't go away. So the physical aspect alone was taken care.
The
And
psychological
they
wasn't
didn't
there.
understand the training part of it, the coaching part of it. So, holistic gray areas is
Oh,
important
what a challenge! Yeah, but this needs to be addressed, Shivdev. You need to take it on and
because it is causing
make it.
disastrous consequences on relationships. And it's a social problem. In my
Yes,
opinion, I
yes.
am personally seeing this also as a social problem because if you aren't actually helping the couples in this situation, men or women or both, individually, it is ending up in marriages being lost, divorces happening, divorce on an all-time high. How many times are we actually attributing this to the sexual problems and the incompatibilities? We're not talking about these things openly, but a lot of them also are because of this, because they're not able to make peace with each other without a proper
They
sexual
find some other
communication.
reason and break up. Actually, there's a easy way I can help people understand that. See, let us say you are invited for a wedding. I tell somebody or some important event, and you can't go. You call, but you have to, you have to give a good reason. So you call up and give a good reason. And somebody taught me this to say, actually, the first three reasons you give are not the actual reasons. The fourth reason is the actual reason. So the three reasons you have given for divorce in the court may not be the actual reason. This is the looking good reason.
Yes.
This is the politically correct reason that to tell the society what's happening. But the reality is something else. So, guys, think about it. Do you want a relationship? Do you want a long term partner? Do you want to be happy? Do you want to be fulfilled? Dharma, Artha, Kama, Moksha. If you want all of those things, learn to be honest, truthful, ethical. Correct, no, Shivadev? You
Correct.
know what to do?
Communicate well
Yeah, communicate well, communicate effectively. And I think half the problems will not come.
because
If
it's
they come,
addressing your fear.
correct. I think then it will actually take it forward to make that happen. So ED is erectile
Erectile
dysfunction. Yeah, so
dysfunction.
that can. So tell me
So
the
the
physical
vascular,
aspects.
the physical
Vascular. Yeah.
aspects are there could be an issue with the vascularity aspects of
Okay.
it, suppose, but for this they have to have another medical problem,
So
right?
I mean, let us explain to them simply.
Done.
Why? How does the penis become erect?
The penis becomes erect
So that they
after
understand there's a vascular issue.
simple. I tell this to all my patients. I
Mm,
think that's the first education that I
mm,
give
mm.
because they feel that there's something about the organ that's not working. So for them to understand, I say simply like, two cylinders are there, third cylinder is here, that's the penis. Each has a main artery. So the artery in the resting phase is 0.4 millimeters. In erection, it has to become 1.2 up to 1.2 millimeters. So there's an expandability of the artery that is there. But who gives the signal to this? The brain has to give the signal to the artery, and then the artery expands because of a chemical release of nitric oxide, a few other things, it releases. So if the system is working well, if there is signaling from the brain that goes to the artery and then expands it, sustainability, strength of the signal has to be the same, attention has to be there. Without that, the vascular aspects goes off. So the vascularity is important to be understood that it is a neural signal, circuitry that connects there. So that is the simple way that direction happens. As long as you're constantly involved and continuous in this process and this is working efficiently, there is no problem. Sudden switch of sympathetic pathway or fear, flight and fight mechanism, common things. A lot of people in ED, they go through that. What if I lose my erection? What if I don't satisfy the partner? Last time it happened to me, what if it happens to me again? They get into this unknown behavior, or unknowingly they get into this behavior of checking the erections repeatedly, excessive focus on whether my body is working well or not.
So they're not even
So they're
enjoying the
not even
process.
enjoying the process, and obviously the switch off happens.
Correct.
So this
Correct.
leads to that. It's a reconfirmation bias. I knew this probably would happen and it happened. So the fear is high again.
And it
So
gets worse.
repeated negative sexual experiences will make you feel that, this is not going to happen at all, and leads to other behaviors like avoidance. I think I am busy today, so I have a meeting. Probably we should do it on the weekend. And Bekanta, because wantedly they get busy on the weekend so that they're going off, they're keeping occupied, coming late at night because preventive. So they don't want to address that fear. So there is a lot of
And they don't want to have one more validation and that
validation
make they
that
feel
this is
worse.
happening, and they keep waiting, taking supplements, off the shelf things, or maybe trying something else without addressing the real problem. The female partner in this situation, she also feels frustrated waiting for so long because they wait on it for about 2 years, 3 years. They're at their wits end, right? The female partner is so frustrated, and I have to ask them to be calm, like, because work together, because this is leading to that, that is leading to this. So if you address this early on, isn't this simple to understand, take care of? So ED, the vascular aspects of it, then comes the hormonal aspects, testosterone, the hypogonadism, that FSH, LH, prolactin, the brain hormones that has this chemistry. The arousability comes with neurotransmitters, dopamine, serotonin. These interplay also happens. The physiological responses, these are. Then the psychological connect. I think all of them have to be looked into, if at all, to understand what is the cause of ED. Porn, masturbation addiction, few other things that the previous responses, because it is the constant programming that they would have been used to, and the brain recognizes only that. There is this concept of prone masturbation. Again, education. We need to educate the kids about these things. We need to be able to talk as parents or well-wishers, doctors, pediatricians can initiate, we can initiate, or school should also think about these things for parents themselves. Because the way of masturbation, if they are prone masturbation, where they are just on the bed rubbing themselves, they don't even need an erection to masturbate and release. So people specifically in this condition, I see, they come up to me and then they have
Yes, sir,
prone, prone,
prone
prone,
position. Oh, they do
prone,
prone position.
prone position masturbation.
Ramachandra.
Prone position masturbation, because of lack of awareness. They don't know, it is incidental, right? So I'm just lying on the bed and I start doing something, then it feels nice. So it is more of curiosity that led
I
them
thought
to
you said
that.
prone
Prone,
position. I was
prone,
thinking porn. What was it?
prone.
Oh, that face down.
Yeah, face
Yeah.
down, rubbing. So
Oh
this,
shit!
there
I
is no
never realized that.
requirement, right? There is no requirement for them to
Correct.
have an erection at all. And then they're like rubbing and constant genital signals. I talk about this a lot. Constant genital signaling to the brain is the way that you're programmed. And then when you go there, you need to go from a top-down approach, not from a bottom-up approach. So these people, when they're with the partners, they're not able to get that erection, because of which
And
the
this they would have done as
problem
a child and adolescent,
continuous.
and that has made a mess in their adult
Yes,
life.
yes. And
My
they're not able to let
goodness.
go of that, because the way that the programming has happened is only
The
when they
circuits to sensations.
circuits to
Hey,
sensations, right? The
my
way
goodness.
the way that this has happened, no other aspect can give them as much pleasure as this gives. So they try with
Because the
the
brain is we kept
yeah,
that as the benchmark now.
that's it. So that is the way it works. So any genital stimulation, partner stimulating, oral sex, nothing gives. So they try it, because they're not able to complete. They go back to doing that, because that is the only way they
They're
know to
getting pleasured.
release. So they're not able to. I have had these challenges in my patients and couples, right? So they're not able to progress further, because they're not able to get off that, and I need to rewire them. But if without undoing, I can't redo here, and they're
Oh,
not getting
damn tough,
release.
yeah,
They're
damn
not
tough.
getting that release.
Oh,
So
it's
all
a
of that,
trap. It's a
it's a
trap.
trap. So masturbation practices I mentioned because of that, for the ED part of it, porn induced, and then there's a lot of different kinds of kinks, right? Kinks or fetishes. It's okay as long as you're knowing, what you're indulging, because if that becomes exclusive, then it's a problem. It could be BDSM, it could be foot fetish. I've had patients where I've, done a lot of therapy on foot fetish and, BDSM related aspects of it, and then help them to rewire and then make that as a part of the thing, not the exclusive thing. So here also, the brain selectively chooses it. It could be anything. It could be anything that the brain fixates on: certain type of women, certain type of partner, certain body parts, certain kind of sexual activities, or it could be certain kinks exclusively because it is available on the internet. Porn is available for a lot of people. Of course, legally it is not here, it was banned, but people have access through other areas, and then they can. It's a wide world on the internet. So if they get fixated constantly, the amount of dopamine that gets released when they're seeing this, visual, auditory, there is nothing to prove to anybody, no anxiety about it. So it
Correct.
gives them maximum results.
So it comes to the chat GPT, something similar
Comes
to the chat
max,
GPT
yeah.
business.
And then there are a lot of AIs also, right? The connection um, part of it, if we want to talk about, somebody is not able to forget about their ex, fixation of that. They're able to use some AI, create the avatar of that person, interact with that person regularly,
Sure, Rama. They're
and
doing all of that,
they're
huh?
not able to detach, and then they're able to
And
make
it makes it worse.
makes it worse. They're able to make videos of it. They're masturbating to these things. It's like fixation to the brain. And
Crazy.
technology
Then it
has to be
becomes a
used.
mental health issue after some
It
time, eh?
is sexual health, mental health, relationship health. How do we differentiate this, right? So it is so integrated. And programming to these things also represents to me as EDs. So what is
Oh,
ED?
they came here, problem is here,
Problem
problem
is
is
here.
there, somewhere
We need to
else.
figure out. We
By
need
the
to
time you
figure out.
half a lifetime to figure out where the source of the problem is.
So
Kalwa.
allowing someone to help you with the problem is the easiest, right? Why do we need to figure out everything? So I think that ED has all these areas: prone
Very
masturbation,
tough, yeah. This is a
programming.
very tough thing for, I
So
mean, not only for you, for themselves, because
yeah,
they have so many layers of
layers
things
for
that is
them.
built
Then
up
the
over
distress
time.
is huge.
They don't even know which layer they have to peel off to get to the next layer, to get to the next layer, to get to the source of what is
Source of it.
happening.
Source of it.
Poor
So
people.
these
I
are
really feel
EDs.
bad.
And how can this be treated only just by popping a pill?
Correct.
It is not possible.
The pill is
And
only
people,
physical.
it is a supportive treatment only. Rewiring, rebooting the brain is what we need to do. Without that, it doesn't work. So ED is that, and sometimes ED presents as premature ejaculation.
Okay.
Right? So we spoke about the hormonal aspects of it, psychological aspects of it, neurophysiological
So
aspects
before
of
you
it.
go to premature
Yeah,
ejaculation, you were talking about the blood supply. You spoke to me about a scan for that.
correct.
I
Penile
think that
Doppler.
that may be this is the
Oh
right place
yes,
to
oh yes,
talk
oh
about
yes,
that.
oh yes, yes. Because
So let us sort
figuring
that out.
out whether there's a vascular problem or not, I want to
How
caution
common
that.
is it in younger people?
So
Is it
it's
very
pretty
common?
common today
Really?
because of chronic stress and the
Really?
lifestyle,
Oh, the signal is
high
not coming here.
high sympathetic
Oh,
activity because of the ways. Like a lot of my patients in startups and in Koromangla, right? So I have a lot of IT people coming in and startups. So I see that bad lifestyles, junk food, excessive smoking, indulgence in other substances perhaps, and excessive amount of working hours. Now, if you look at the current situation, I'm talking, right, geopolitical situations, or the companies offsetting so many people, it's a huge distress. Now, I really feel for them. They are battling so many things. All the IT guys, every day, and then Bangalore is getting worse in terms of so many things. The traffic woes are adding on. No, I think it's important to see all of these things, to see, what are we going to do to help them. Not that we need to go to and clear the roads, but they are part of the problem, right?
Correct.
They are part of the problem. The stress is high, smoking, alcohol, these risk factors are very there, and attachment styles, not being very secure in the relationship, and psychological factors, and then one night stands and swiping left, swiping right, trying to figure out the right partner with the apps that are there, inability to forget the previous partner. So many such things are causing huge, and then that's why I'm having patients, or it is quite commonly seen from 25 years of age also these days. Earlier it was 35, 40, around the andropause. We should
To
talk
to
about that
others,
later, right?
the
Yeah,
circulation problems,
yeah,
huh?
circulation problem
So
where.
what does the penile Doppler do?
So the penile Doppler test identifies how much of vascularity is there, like what is the pressure of the blood flowing into the
Hmm.
corpora
So you
at
check it
5.
both without erection and with erection?
Actually, the correct process is you should be giving an injection of papaverine, and then
To
only
the
the
corpora.
to the corpora,
Both sides?
both sides,
Hmm.
and then only be able to check that. And then at baseline, 5 minutes, 10, 15, and 20. And then what is the pressure that is coming in, and what is the EDV, that is end diastolic volume, how much goes out, like inflow, outflow, both are measured. And at least a minimum of 30 PSV plus has to be there at 5, 10, 15. And if that is there, then it's fine. But the problem is there is also a variation of this test, which patients should be educated and will be educated also, that there is an office-based sildenafil test, because a lot of patients are very hesitant to get an injection into the penile because this requires an injection to be given, and a lot of radiologists aren't really doing that. They're very specific people, like some uro or andro or some radiologists, they are only doing this. So because of the lack of such availability, they take a pill and then the test. It could be false negative. That's the problem. It could be false positive also, because even without the problem, because the upper chamber is not activating that, and you're in a office setup, and somebody is trying to do the test on you, and then you're just only on a oral this thing, you're anxious, and somebody is asking you to watch porn, stimulate yourself. It's a pretty horrifying experience for patients in that situation. So they should know that, how to get that test done, where to get that test done, what is actually the reason. Because if they come out with the false positive, when you don't have a vascular problem, and because of these other limitations that are there, so we should see as clinicians also, it's important to integrate how much of the test, results are there, and what are the other factors. So integrating that becomes our job. Okay, the test says this, but we don't read the reports. We treat people, we treat patients. So educating them, it is one of the thing, but we should also look at the test properly, interpret the test properly. Penile Doppler is one of the things, but it is not 100% gold standard. Integrate that with so many other things, and then think how much contribution. I have to see, like, what is a pie
Correct.
chart,
A
what is
360
a
degree.
360 view.
Correct. So once you have finished the penile Doppler and then you have done whatever you have done, and we don't go into the details of that, then you are saying the psychological aspects of that. So what do you do in ED with psychological?
Psychological aspects, we train them and coach them.
Okay.
Because I told you about these behaviors, like, the thoughts are intrusive, repeated automatic negative thoughts, like, will it happen, will it not happen, will this cause consequences, will this cause failure in my relationship, will I continue to have this problem. Then the other problem is, I tell them that you take a medicine, you get better. Also, patients have a problem. They said, sir, I think I've taken the medicine, I'm better, but does that mean I have a deeper problem and it'll never go away? I always have to be on medication. One is that. The side effect of the medicine, which are there. So that also patients are worried about. Should I take the medicine? Should I not take the medicine? So I think the psychological factors are about performance anxiety and a certain set of behaviors that I spoke about. Repeated checking, rechecking, behavioral aspects of, avoidance, not even going to the bed, not even trying. So there's two kinds of desires: spontaneous, responsive. It is like hunger, right? Sex is like hunger for all of us, like, sleep and basic needs. Like, everybody has those automatic thoughts of sexual things coming up. For some people who have had these disorders and going on for a long time, the spontaneous desires are suppressed in them. So spontaneously, whatever we're supposed to feel about sex, they don't even feel. So in that situation, we need to engage and then get the responsive desire. So you're not engaging, you're not getting desire, you don't have desire, you're not engaging at all. So I think couples are stuck in that phase.
It's a chicken or the egg situation.
Yes. hen and the egg situation or chicken or the egg situation. So because of that, nothing is moving at all. So psychological distress is high, and then the chances of trying out things outside the marriage. And there is a fear, even though people don't do, there is a fear in a man so many times that, if I don't become all right, I told you about the people who are trying to come before marriage to find out about their sexual fitness. They have this fear that if I don't perform, then my wife may cheat on me. So I want to know. And other aspect is,
That
yes,
additional stress.
additional stress. Other aspect is that, I don't want to, spoil someone else's life. Very, very, very common dialogue. This is, we should mark this, because that is the one thought that goes in a
Which
lot
is
of
a fair
people.
thought.
Fair
But
thought, but that makes them feel so low, and then they get help. That's better. But I don't want to spoil somebody else's life. So they come in for sexual health checks even before marriage. Premarital workups we do. So these are also educating about all of the four pillars. I speak about all of that, like how you need to entice, what you
the
need to
4
do,
pillars of Kama
all of
Sutra.
that, because what is your duty, and then
Excellent.
because it's not premarital thing should come from there, right? So it's not just about organ, right? So those things are also there as part of psychological. So we do a lot of exposure response prevention or therapies, basically like psychotherapies, helping them to separate their fears, separate the facts, train them on certain behaviors, bringing them confidence, add lifestyle related changes. If at all obesity is there, reduce obesity. We work on smoking, alcohol, sleep cycles, and specific aspects that health outcomes has to be better. So when they get better with it, along with that, I start introducing them into couple therapy. So get the partner's distress off, help the partner to understand these problems, and then get them rooted on a repeated angle, so that 6 weeks, 8 to 10 weeks, they feel so much better, and they're able to rewire themselves. So without that, if you just simply sit at home, pop the medicine, and hope that something will be better, it may not work for all. So psychological distress, this is how we handle with combination of lifestyle as well as therapy, bringing them insight, understanding, helping them to know what works, how to keep the signal flowing
That's the biggest
constantly.
challenge.
That's the biggest challenge. That's the biggest challenge, because psychological awareness is different for different people. Their fears
And
sometimes
the
don't
mind
allow.
keeps playing games, keeps going
Exactly.
all over the place. Yeah.
Mind keeps playing so much of games, and then to change their belief system
Correct.
is a Herculean task.
I agree.
But there is a process, and if
I agree. If it works, which we want everybody to get
yeah,
benefited.
it works.
Yeah. So
It
what
works.
Dr. Shivadev is saying, it works, guys. So have heart, have
Don't lose hope.
Yes, don't lose hope. Make sure that you make an effort, because this is one of the fundamental pillars of life itself for you to have a fulfilled life. So you must go for it. So premature ejaculation is what we started next. So why does the premature ejaculation happen?
Two categories to understand that. Firstly, there's a difference in understanding of the premature itself. Like, for some people, I have had patients where they're doing quite well for about 5-10, but they come and complain like, I think I prematurely ejaculated. I said, what's your time? 5 minutes after penetration, 10 minutes after penetration. Why do you think it's premature? Because I wanted it to be longer. So it's important to understand the definition. Less than a minute to 2.5 minutes, 2.5 minutes to 5. Severe, moderate, mild. After
Can
5
you repeat
minutes,
again?
severe premature ejaculation is less than 1 minute, mostly less than 30
After
seconds.
penetration.
After penetration. Less than 30
Mm.
seconds to a minute. Most commonly less than 30 seconds, or sometimes even during foreplay they ejaculate. That is the severe form of premature ejaculation. Up to 2.5 minutes.
From
That is the
penetration or
moderate.
foreplay.
After penetration. All of this is after penetration. Right? 2.5 minutes to 5 minutes. That is the mild. So after 5 minutes, we want to give a proper understanding that it is supposed to be normal. It is considered as normal. The rest after that, it is about choice and working on these things. But disease or disorder perspective, these are the things, and then we can further branch them into primary or secondary causes. For secondary means there were times that you were doing well. It's not been from the first episode, from the first time someone has sex. If it's been a repetitive experience
not a
for that
one-off.
person, it's not a one-off. It's been a repetitive experiences. They go to a primary category, and then sometimes I was doing well, sometimes not doing well. Then there are other reasons like infections, loots, such as lower urinary tract symptoms are something that is pretty common. Prostate related issues can be there, or the serotonergic sensitivity that is there, the sympathetic pathways. I told you that it's pretty common in people with anxiety, obsessive compulsive personality problems, depression feelings. Sometimes medications also can cause the prolonged or delayed ejaculation, right? Cause suppression of the signals and units. That's where the mind and the sexual health part of it. So the secondary
you
causes
should
are
take a
different. We
history
should
of
take
pharmacological history also.
everything, because interesting that you brought in. I'll go a little offshoot, come back to premature, right? So One gentleman had come. He was my old patient. He was 60 years old, and he lives in the US. He visits India once in 6 months, and then he has his family here, visits and comes. Whenever he visits me also for his sexual health concerns, and he's doing quite well. Young, I mean, he's young at heart, 60, but young, I would say. And then he's energetic. He has his passion for life, keeps his sexual health active, doing fantastic, plays tennis, cardiovascular fitness. Everything is great. Has a proper outlook to life. So what I also want to tell you is two things: that age is just a number. It doesn't mean after 40, 50 it's all done, we have had kids, we should go off. It's not that. So he came, and then he said, Dr. Shivdev, I was doing fantastic with all the things, and medications and supplements, and the advice. I don't know what changed. Then I reviewed his history. Recently his antihypertensive medication was changed. So whenever they're taking a BP medication, it can also reduce the flow, right? So because of that, the erection, I wrote a letter to the physician. I said, he has experienced it, because I left it to them to decide. I said, identify it, go back to your physician, talk about it. He came back happy. Physician changed, this changed. So there could be like an assumption that, oh, young male, then probably this is okay. 60 years, it's okay. So we also, as doctors, we should also think like, everybody could be sexually active, right? So we can't assume that, oh, is a 60 years old man, what erection? No. Post cancer, what erection? Of course. Post mastectomy, what sensuality? Of course. Everybody is entitled for a good sexual health. And nobody decides on that. Nobody should decide. So it is important to embrace these things as healthcare professionals, as doctors. We should ask these questions, simple questions. How are you doing there? And how are things? How many of us actually ask these things as doctors? We aren't asking about it. So diabetic clinics, how many of
Diabetes is, I think, one of the big.
yeah, very important. How many of us are asking in cancer care? How many of us are asking? I think we should start getting integrated. It's not that we don't care about it, but we have to have that outlook to this also as an overall quality of life. That is what we are trying to discuss here. It's an overall quality of life thing. The patients may be hesitant to talk about that. Okay, he's a cancer specialist. How can I talk about sex? Because patients have that inhibition. Oh, this is this doctor. How can I talk? It's okay. Please talk to your doctors. Doctors are there to answer all the queries, right? All of us, we are more than happy when patients ask us questions, any doubts, come up to us, talk to us, get more knowledge. At least relevant knowledge is there, not some internet garbage that goes on. So coming back to the premature ejaculation, but I took an offshoot for saying that the medication change and how this vascularity part of it. So the second aspect of it is the primary part, which is a little difficult one, right? A lot of people, 25% of men can have these things. So primary part is ingrained in your nervous system. The sympathetic activity or overactivity which happens suddenly releases a signal. And then sometimes even before penetration, extremely distressing for the couple. And once it happens, there's a huge morale shift. Partners divert themselves from other things, sleeping, crying, not discussing about these problems, constantly worrying how the next session will be. So all this overdoing of Kegel's exercise, there is this thing, right? Read upon this thing, do Kegel's exercise. I've had a patient who overdid Kegel's exercise, and when he came to the clinic, he couldn't sit. He was like, I asked him, like, what happened? He's like, sir, I was overdoing Kegels. And then I had to send him to physio and pelvic floor
Actually,
rehabilitation
all the
to
myofascial release.
undo, yes, myofascial
Myofascial
release.
release.
Imagine, like,
Come
how and
on.
where these things are coming from. So, premature ejaculation has so many concepts because it hits the self esteem, self worth,
Like,
self confidence
everything comes there
terribly.
only.
Terribly. It's a
Everything
sense
comes.
of self.
Agreed. Agreed.
No sense of self. I can't be
Nothing else.
happy.
Yes. Yes.
Quality of
Yes.
life, relationship. I
Agreed.
can't be doing
Agreed.
well in work.
Agreed.
It comes as these things. So, I think the serotonergic pathways have to be rewired. So, there's a lot of training, like, lifestyle, breathing exercises,
So who does
relaxation
it in your
training.
clinic? You're doing it
So we
yourself?
have it. No, I have a
Psychologist.
psychologist who trains on all these things. I recommend them. Lifestyle specialists are there. Pelvic floor, training specialists are also there. Yoga therapists are there. So they all have their own roles. And sometimes we do as a workshop also. Sometimes it is like in this thing, because I don't see that the clinic model is fitting completely here. We need to engage with, like, Saturday you come over, do these things. Sunday you do these things. So it's a constant coaching.
Got it. So the next question that comes with that is, you spoke about three S's. It's the sex, the size, and the stamina. Let's
Correct.
do to the size and the size. A lot of people think that the penis size has to be big, small is not good.
So common.
Huh. So, what is the myth and the stigma in that? Can you educate our
Correct.
people?
Medically, micropenis, there is a condition like called micropenis that is primarily diagnosed very early on. Endocrinologists will identify this very early on. Physicians will identify this very early on, where there is no growth spurt, right? There are syndromes that are associated with, as we are
Correct.
aware
It's
of.
more
So
hormonal.
hormonal
Yeah.
part of it. So that is a different thing. If it is that, that is a different issue. And also hypospadiasis, or somebody would have gone through surgery. Those are all different things. That is not the criteria that we want to talk about. Other than that, endowment, normal endowment, but the perception that the size is small, and also the facts and the belief systems, right? There is a belief system that longer penis, lengthier penis, and girth wise of it, I can satisfy my partner more. More size means more energy, more power, and more stamina. That is not true. That is not true at all. So, because multi-integrated systems, we spoke about cardiovascular, neurological systems, hormonal system, neurotransmitter system. What's that got to do with size? Exactly. Right? I ask this one thing to break this. This works with my patients. Like, okay, you have the size problem. I examine them and all of that. So anything more than 1.5, 2 inches is not considered as a micropenis, right? So
That is at the fully erect
yeah,
situation.
yeah. About more than 2 inches of penis is good enough, because the sensory areas around the vaginal areas is up to about only that much. So anything more deeper also is not really satisfying, but it is something, a sense of fullness that they can experience, and also the belief system, right? So that is a clarification around the penile says. I ask my patients this, that, okay, let's say that somebody had 4 inches of penis, is performing fantastic. He is extremely good in his bed. He's having fun. He's able to give pleasure to his partner. He is able to enjoy very well. Both of them are able to have a good, satisfying thing. Do you think this person will come to me with a size problem? So, what is the problem then?
Exactly.
Is it the size? Not really.
So size is not the issue.
Size is not the
Okay,
issue.
size is not an issue at all.
Yeah.
It is the sensitivity and the excitement and the benefit and the performance that's the issue.
Yeah. So this question answers that. Will they come to me? No. Then I said, that is the thing. I do understand. So working with them to make them reattribute that, okay, it's not physical. So
So that's a big myth that
that's,
you're broken.
yeah, that's
I
a
think
myth.
that's a brilliant answer. You don't have to dig more.
Yeah.
The next is stamina. I have patients coming to me as a neurosurgeon saying that, I masturbate every day. I masturbate 4 times a day, because of which I think my stamina is less. What will happen if I get married? Am I going to get out of semen?
True.
All sorts of stuff,
Semen retention.
and yeah, khali ಆಗ್ಬಿಡ್ತಾ,
ಖಾಲಿ ಆಗತ್ತೆ.
those kind of stuff. And,
ಹೌದು.
they have this entire guilt trip at the end of the day. Somebody said this, somebody said that. So
True.
can you throw light on that?
Masturbation, addiction, and as well as semen, right? So yesterday I had a patient who came with similar problems, where said, "Sir, I think nan semen ella khali agide. There is no semen in my body, because of which there is no stamina." Exactly this, and he has visited many doctors already, even 3, 4 psychiatrists also, because everybody thinks, like, they check him up. Urologist sees, "Hey, boss, you're all right," which they have done their part, and then said, "Go somewhere else." And he refuses to believe this to be a psychological issue. His belief system is so deeply rooted that this is semen is important. And even if you look at ancient texts, they talk about semen retention as one of the things that gives them attention, concentration, and samruddhi.
Really?
Yes, couple of them.
Oh,
Yes, Ayurvedic things, texts. Some of them have references, but that was ancient texts
different context.
in a different context, perhaps. But scientifically, there is no evidence to suggest
It's
that
like,
semen has
it's
got
like
repentant.
saliva. It's like
Yeah,
anything else.
regenerative. I tell my patients this, like anything: skin, hair, nail, semen, saliva, sweat, blood. Everything is regenerative. You lose semen, you will get that. Factory does this in 3 days. Your testis is doing it. Specialized cells are there. Sertoli cells are there. 3 days. So it just starts regenerating. So you need to wait it out. They have also this concern that they would have had sex today or masturbated. Tomorrow they feel, sir, my semen is very thin. Of course it would be, because 3 days are required. You need to wait it out, and trying to check compulsively, like, today is it getting better? Today is it getting better?
By doing it again,
By
that's getting
doing it
worse.
again,
That's
it's getting
stupidity.
worse. So there is
Oh,
this knowledge that needs to go to
and
people.
patience.
Patience has to be there. Knowledge has to be there that this is normal. It is thin because it takes 3 days for me to produce it. And even when somebody is wanting to test their sperm count, right, they need to know that one exit or the semen load goes off. Three days you wait. Fourth day you give the semen and sample for testing, because or else you'll get erroneous results.
Guys, you have to remember this. You can either smile and accept it. You can feel bad and accept. You may think, what is the emotion that we are going through. We're just trying to make sure that you don't feel bad about it. We're just trying to make you understand it's just a simple thing. It's just psychology. It's not like cancer. You're going to die in this process and things like that. And also in semen, there are two parts. There's the secretion. There's also the sperms that is there. I think the sperm is what adds the thickness to that, and that's why it takes 3 days to do. So you have to understand all of those things. So this is the why I remember very clearly saying, myself to myself also, that when you want to, impregnate and plan a baby, you should not have sex for 3 days before that, because then you have good, volume of sperms in that, so that the impregnation chances becomes very
Becomes
high.
high. Quality of the sperm
Quality
also.
of sperms
Quantity,
become high,
quality,
and
motility.
so much of that, and that's why not too long, not too less, and things like that. So so masturbation, we are giving a message. It just doesn't make a difference. But if you are masturbating and you're getting obsessed by that, that's a mental health problem. It is not a physical problem.
True.
Can I say that?
Perfect.
Yeah,
Perfect.
it's a mental health, and beyond that, there's nothing going
Nothing
on
going
there.
on in the
Yes,
body.
it's not
Nothing
going to
will
affect your
change.
stamina. It's not going to affect size of penis. It's not going to
Yeah.
affect your sexual life. It's not affect your life. Nothing is going to affect. So
They
don't
have
get
this belief
stressed.
that, my muscles are going off because
Vartada, ಹೌದು.
muscles, Allah.
Yes, yes.
Muscles are going there. Sir, I have a lot of dark circles around that, and I'm like, thinning of hair and all of that. This is coming from you. It's an important mention here. There is this culture bound syndrome. You asked me whether unconsummated marriage is different in the West and the East and all of that. This one is very specific to certain cultures. So there is this thing called as Dhat syndrome in us. Dhatu is semen, Sanskrit. So Dhat syndrome ಅಲ್ಲಿ ಏನಾಗತ್ತಂದ್ರೆ, there is this belief system that semen retention is good for us because I want to retain that. It is a vital fluid for my body, right? Vital fluid
The
that is
vitality-ಗೆ
vitalityಗೆ ಬೇಕಂತ. So whenever this belief system is deeply rooted for some people, they feel that any expulsion, auto ejaculation also sometimes happens because they don't masturbate at all, and nightfall happens. They feel extreme distress associated with it. Oh, I've lost my semen, then I've become weak. Seeing that itself makes them like, the psychological stress happens, and you know how stress responses can create physical responses, right? Stress is not just psychological, its sympathetic activation causes extreme physical. So they attribute this
Yeah,
without understanding.
if you keep saying
Yeah,
I'm sick, you'll feel sick.
without knowing that psychological stress can express itself as physical problems, they attribute the auto ejaculation or the nightfall, or even after they ejaculate, the guilt trip that happens because of this belief system. There is also this Dhat syndrome as one of them. Kuru is there, mostly in South African regions, where they feel it is going into the abdomen. The penis is shrinking. It's going into the abdomen because I'm constantly masturbating. Or I have these questions where, sir, can I have these masturbatory practices for X number? I say that, it's about the ratio. You have a partner, masturbation, right? 20 times you're masturbating, one time you're having sex with the partner, wrong, right? Keep this ratio up. There's nothing like a magic number to that, but if at all you're doing it for stress relieving, don't do that. You're simply doing it because of boredom, don't do that. You're doing it to go to sleep because it improves prolactin, and the sleep cycle gets
Oh, I
better.
didn't know that.
Yes.
Oh.
So that is why a lot of people
Oh, fall asleep even it, literally.
because it causes the changes in the hypothalamus, right? Hypothalamus regulatory, FSH, LH, prolactin, this, see
Thanks
the
for saying that.
brain and the body connection, right? So they do that, they masturbate, and they're able to go to sleep. They feel relaxation, release is there, sexual release is there. Sexual release is tension release. Plus, there's hormones, not just about psychological hormones and they're not
Interesting. I didn't know
integrated.
this aspect at all.
Exactly. So they do that. So doing these things puts them into a compulsive loop. So if you feel very aroused and it's been a while, you masturbate, nothing wrong with it. Nothing wrong. Partner is not available, nothing wrong with it. So I think that has to be very clarified to the people.
Why I reacted like that, as you were saying, is I have read, many circumstance situations where, the man ejaculates and gets an orgasm before satisfying the woman.
Mm.
And the moment he finishes, he turns that and goes to sleep.
Yeah.
And the woman is left high and dry.
High and dry. That's where
Literally.
that's where the line comes from. High and dry.
Dry.
There's
Oh,
no
really?
arousal. There's no arousal.
Oh,
You're high, but you're not having any arousal. There's no dryness.
And then they're upset.
Leaving high and dry.
They think he's very selfish. He's done what he wants and go to sleep. And I'm telling you, there's so many people who I've heard
Very true.
saying this.
Very
So
true.
that's a
There are
very
other
important.
ways.
So I didn't know there was a hormonal connection to that.
Yeah.
Oh,
Because
this is a dimension that I didn't understand.
Yeah.
I didn't get.
And
it.
hormonal, speaking about hormone, I'll just give a couple of lines on what you said, because I want men to understand this. Even if you ejaculate early, please prioritize both your pleasures equally, right?
Correct.
So
Well
also
said.
do a
Well said.
lot of other
Well
things that
said.
you can pleasurize the
Yes,
partner, because
yes,
she will bear with you, and
yes,
then
yes.
what starts off as a man only problem in premature ejaculation ends up being a couple problem. So we need to address with the couple as well.
Balance the two.
Balance the two, balance everything, all of these areas, and then only it gets better.
Brilliant. So I was going to talk this
Yeah.
topic a little later, but no,
Mm.
but because it came up in this balance the two that you have said very nicely as an extension to this. So suppose they're having this imbalance for
Mhm.
whatever reason, and
Mhm.
it's taking its own time to get better. Can the use of sex toys bridge that gap so that the woman can get the pleasure? Is there anything that you recommend something
Yes.
like that
Yes.
to do?
So sex toys are great, but they're also tricky, because ultimately everything is about programming the brain, right? So because when you use a toy, so it should not be used, my opinion, my professional advice as well, it should not be used in certain conditions. If at all the couple are in an unconsummated relationship, please don't use sex toys, because you get
Well
stuck
said.
to that
Correct.
and
And
you're
you will not consummate
never
at all.
going to consummate, or hardly that you'll think of consummating. But if at all you feel like you have had a fantastic sex life and you are continuing to have a fantastic sex life and want to bring in some variety, then please feel free to use it. Yeah, not to move away from a disorder or a distress which without addressing you just getting a release. Then the programming happens, because the vibrators have about 10 modes, 20 modes, 30 modes, different things are there, internal, external, very type varieties are there. So when you start getting used to that, the vibratory senses, how can the penis give you the same experience? You're programmed to that, programmed to the vibrators, programmed constantly, without realizing that that is a different thing and partner related sex is different. A woman may start feeling like, this is not giving me pleasure. And as it is in the orgasms part of it that we were discussing earlier, there is a clitoral orgasm, peno-vaginal orgasm, and a combined orgasm, multiple orgasms, right? So a lot of women experience mostly the clitoral orgasm when the clitoris is rubbed or when there is oral sex done and all of that. Some of them can help them to understand what it feels like, because it is awareness of the woman's body. KYB again, know your body, know, understand what happens. So
And some of
during
them have some more erogenous
more
spots
erogenous
than other spot.
spots and doing
Everybody is
other
not the
things,
same.
not the same.
Correct. Correct.
So the vaginal sex, some of them, when they don't experience pleasure in vaginal sex, they go to the vibrator part of it. They say that I am able to feel it here and then this is not there. They may start rejecting sex. So it has to be understood that we are bringing it as a couple thing, interplay, not exclusively, but be inclusive with it. If you use sex toys exclusively, it's a problem. If it's an inclusive thing, it's better for
Got
the
it.
couple.
Got it. And both of them agree to
Both
do
of
it
them agree
together.
to use that, and you should know
Perfect.
that,
Yes.
because there are a lot of masturbatory tools or toys that are available for men as well,
Also, I agree.
and also for women. So both of you should be open about these things, explicitly state that let's try these things and then bring them into the bedroom, not only to do this by yourself but as a part of the couple. Then it's okay. Or else if you don't use that in the right way, unconsummated relationships can actually mess up.
That's a good point. So good point. So everything like we say, no, high blood sugar is a problem, low blood sugar is a problem. So anything in moderation,
Yeah.
with acceptance, with communication. I think the whole theme is going around the same thing. You're entering from different ways, but
But
the core is
integrative
still the
approach,
same.
yeah,
The core
integrated
is still the
approach.
same. There's a physical aspect, there's a psychological aspect, there's a couple aspect. All the three, I think you have to put it together. I think for it to be fair to the whole process, accept the limitations also if there is a true limitation that's going on, to know how it does. There's one more thing that happens to especially younger boys when they're going into teenage and going up, is this nocturnal emissions. So since we are in the process of premature ejaculation, let's talk about nocturnal early morning erections and nocturnal emissions. Let's tie up these two together so that people again think that's a problem,
Yes.
and things like that. So can you address that issue?
Nocturnal or auto ejaculations can happen if there is a disease condition such as UTIs and few prostate related, where some secretions are excessively produced or released. And also when there is a sleep, right, we have a general tone reduction, so there is pent up energy or pent up secretions which are there, can also come. Unless until, like, if there is no infection, then we can reassure, we can tell them that not to worry about it and you haven't indulged with the partner more, or the production is happening and then you're not using it.
An
So because
overflow,
of it,
like
overflow. So
simply
that's
put.
that's yeah. If the tank is full, it'll overflow. That's the way that, we can reassure them. And, there's a lot of anxiety associated. We can do that. And early morning erections part of it, very interesting topic, because people diagnose themselves with ED because they don't see erections sometimes. Early morning erections.
If they don't see.
If they don't see it, because they have thought of this as a gold standard, because, oh, this is early morning erection, it has to happen. Early morning erection is an indicator of vascularity, it is an indicator of testosterone levels in your body. So when they keep observing that today did it happen, tomorrow it didn't
You
happen,
that
three
they're
days,
so obsessed with that, huh?
that is the anxiety in the
Rama
performance
Chandra.
whenever they
How
don't
many
have
points
sex.
they're having, yeah?
Yeah, when they don't have sexual life going on well, they start observing all these things. All of these things are to be understood. So
Can't
they
blame them also. You
can't
can't
blame
blame
them.
them.
It is that distress, because they want to get out of that. They want to get out. The distress is really huge, and it is real. It is not a perceived thing. Like, it's not like someone, for someone to say, like, it's okay, it's all in your head, just delete it. And I know how the circuits and the sensations are working, and how the brain works, and how that is to be done.
See,
Right?
guys, we are doing this podcast genuinely to help each of you who are watching this, who are struggling with any of these things, to help you to have a fulfilled life. So please reach out to Dr. Shivdev and his team. He'll be more than happy to sort it out. But remember one thing, God helps those who help themselves. So you should be willing to let go. It's like the monkey holding the banana. You need to let go of the banana. Only then new things can happen. If you
Absolutely.
keep on getting into the same circuit, same thing, nothing new can come at the end of the day, and it just doesn't work.
Yeah.
I
Yes.
think that's a very important point that came
So
in.
absence of the early morning erections means something, and presence. So obviously it's an important thing that this can happen in a time where you may not even remember, right? So it would have happened in some other sleep part of it, sleep cycle. It would have happened, not necessarily when you wake up with it, right? So I tell them that, unless until these things are not really a problem, check your testosterone, see if it's okay, then don't be worried about it. It can be also the stress responses that are playing in, because it's a dual mechanism. There is an arousal mechanism and a suppressing mechanism. If your suppressants are high, your arousals are not seen. So it is not that absence of one, they two interplay. So we got to map out these things and then explain, so they are much easier to
Got it.
understand then.
Perfect. Now, men need to also understand that the woman's arousal intimacy thresholds change during the menstrual cycle time of 28 days.
Yes.
So, can you educate our viewers that it's like the men, which is the standard
Flatline.
flatline 365 days a year, more or less. It's not the same for the woman, and they need to be sensitive to that. So, when is it high? When is it low? Can you sort of
Yes. Around the
educate
ovulation
both?
period.
So the women also understand that they
Very
don't know
true.
what's going on, and the men also understand and respect and be sensitive to that whole process,
Lovely.
so that again it is there.
Well said. Understand and respect that, because women's body is very different as compared to men. I think without understanding the basic biological differences, if we think this is a pressure tactic, and patriarchy,
He's
pressure
resisting.
tactic,
She's rejecting
resisting,
me,
she's
or she's
rejecting.
yeah.
So I don't think it will work well. So menstrual cycle first, and there is a model which is different in men and women. We will also discuss that. Very relevant, right? So menstrual cycle wise, around the ovulation period is when naturally evolutionary principles also recommend that there is a increased drive in a woman for them to have sex. Around the ovulation period is definitely the case, where the desire is high. So that is around day 10 to day 17 after the considering the first menstrual cycle. But it cannot also be the same for all. So some people immediately after menstrual cycles also they will be having an increased arousal. But around the perimenopausal or menopausal women, the most important thing is there is lack of arousal, because the physical response is not there. Lack of lubrication, any pain, UTI, lubrication, ensure that if there's heavy flow, if there's fatigue, iron deficiencies, CBCs. And how many times you have detected thyroid problems because of which, PCOD problems because of which, and CBCs, and the hemoglobin being less and iron profile being less. This causes stimulation of the nervous system, presenting as anxiety. We treat that, this happens, arousal problems is taken care of, everything goes. So to understand, this is a normal cycle around the menstrual cycle. PMDD is one of the things, premenstrual dysphoria, which is more of like premenstrual cycle depression. Even before the menstrual cycle starts, mood may be off, irritability may be there,
It's like a
high,
PMS,
yeah,
post-menstrual,
high,
premenstrual, sorry.
yeah, premenstrual, postmenstrual, both can happen. PMDD, PMS. So hormones and behavior go
They
together.
create havoc, yeah,
They
Papa.
create
I mean, I really
havoc
sympathize with the woman,
internally.
because
Yeah, for
sometimes it's
them they're
chaos.
struggling so much,
It's chaos.
and then they have to, like, they are like Durgas, right? Like they have 10 hands managing different responsibilities. I always envision women and I tell them, like, look, it is like you have so many responsibilities you're taking care. You need to take care of your own self, your own body, your own financial
Papa,
aspects
they
of
don't even
it, your
understand
work
sometimes
related
what the hell is
aspects of
going on.
it. Take care of the entire household. How much of
Correct.
responsibilities are
I
there?
agree.
Along with that, the body is playing with them, menstrual
No,
cycles, the sexual
I've
needs. I
seen,
think
yes. I think
this has to be understood,
I
right?
agree. And understood, sympathized,
Sympathized,
respected,
empathized,
and maybe, and
respected.
yeah, and then give them a helping hand and probably make it
Sharing of
better.
responsibilities. Recently, a study came in, incidentally, that you brought it up. Recently, a study came in. Desire and arousal of women is also associated with what is the level of household work that she does and what is the responsibility shared by a man. Responsibility shared by a man is equal, then women is more open for sexual activities, because obviously it is a win-win situation, and then you feel balanced in this thing, because now the gender bias and the gender roles are very different, right? So it is not like a man will go and hunt and bring food and the woman will be there. We are in a modern world, so we need to understand and move along with the times. So these things are the menstrual cycles.
So
And
no, yeah, normally what I read and realized was from the regular, if they have a regular menstrual cycle, from the start of the menstrual cycle, 14 days prior is usually the time of ovulation, 14, 15.
10 days, first day of the menstrual cycle, calendar days these are, first day of the menstrual cycle, count till day 10. Day 10 to day 17 is the ovulation. After that, the ovulation is passed. That is a time when usually the drive is also high.
Drive is high. So also remember that women also, you understand that sometimes if you're not in the mood, it may be a hormone that's playing games with you.
Absolutely.
So don't beat yourself up, don't blame yourself. So understand that there's a physiological issue. All of us can't be the same 24 by 7 by
There's no need
365 going.
to be the same
Exactly,
also.
exactly. And you'll be a what? A robo rather
Robo.
than a human being, and this doesn't work. So it is. So let me ask you another very critical, important question. It's about workplace romance, affairs, and relationship outside another relationship like a marriage or even a living relationship. What's your take on that, and what's the kind of people that you see?
No, this is becoming more common today, is what I can say. And it has always been there, but I think it is even more common because of the current situations. Now, if we calculate how many hours of work are people anywhere are doing, corporate industry or even in hospitals or anywhere, like, it's a huge chunk. And you end up spending a lot of time more with your colleagues, and the way you're able to connect with them because of the way you're spending time and the atmosphere is high. So there are chances,
Same
wavelength and
wavelengths, yeah.
same things and same approaches, team outings, team dinners, team
And the way
vacations.
they dress up and
They
come in,
will,
yeah.
because you're only seeing one aspect of it. Somebody who's coming to work dresses up fantastic and is very presentable, and then the same person, when they go back home, you're not seeing them there. But whereas you can see your partner in a home attire and not in that way. So that is where Kama Sutra also talks about appearances and aesthetics, and it's so important to be prepared to not to get into these things. But still, the connection that develops, the ease of doing that, the moral compass and the ethical compass goes out of the window. The dharma part of it is forgotten, the karma part of it is enhanced, and because of which the brain also gives you some justification. Now, not everybody is going to do that. Some of them talk about harm avoidance and novelty. Some people want novelty, they will seek more. They are more experiential, they want to be explorative, they're very curious, they have the thrill seeking behavior. So people with these kinds of tendencies tend to that more. And also, harm avoidance or risk appetite, right, for them is high, so they are willing to take risk for that experience. So they don't realize the long term consequences of that, because of ease, because of the connection and ready availability, and the way that the newness and the excitement, it fills them up with something that they felt was missing in life.
The spark comes
More
back.
so, spark comes back, makes them feel young again, makes them feel like the head rush happens all over again. And then the 7 year itch, the so-called 7 year itch
Oh,
that we
what is the
talk
seven?
about, the 7 year itch is like, once you're been in this marriage for about 7 years, and after that there's like a kind of a model which says that 7 years after
Monotony.
marriage, monotony sets in, boredom sets in. So the 7 year itch part of it, Marilyn Monroe, and then these kinds of references are there. But if at all you feel less in your marriage, either emotional connection is less, or physical attraction is less, or sexual connection is less, or compatibility is less, or you're not able to resolve on so many differences that you both have as a couple and all of that, it is not the reason or justification for you to go back to someone else and enjoy a
Easily.
thrill seeking
Yeah,
things.
you can't use
you
it like
can't you
a
can't use
tissue,
it.
the
Yeah,
use and throw napkin.
you shouldn't be doing that, because the impact that this can have on yourself and also another person who's involved in this kind of relationship, and also the ones
The
that
family
are at
also.
home. Yes,
His
the
family
family,
also. Yeah.
with kids,
Kids,
with
yes,
family. So
yes.
there's so many lives that are there. Yes, I do understand it is a exciting thing, and the connection that you felt with certain person can be intense. I'm not even judging that. It can be there, it can be real. I'm not even saying it's just physical. There could be a deeper bond, deeper connection. The way you feel with that person, the way this makes you feel about the relationship could be so intense,
And maybe justifiable, fair.
justified
Yeah,
as well.
yeah.
I'm not even suggesting it's not justifiable. It's like a kick or something. It is justifiable because you've not met this person earlier. Suddenly you meet this person, but you're in a situation of a marriage already, and you don't know what to do, and you're struggling. And many people, before even they're able to decide, they spend a lot of time deliberating, thinking, recalibrating what to do, what not. So they're drawn with two opposites, like one, the duty part of it, that I have to be moral, ethical, and the other part of it's like what I truly want. So they are justifying, like, they're divided. This is something that I know that I enjoy and I want it, but not. So it's about that balance that we need to try. And then that is one of the reasons why a lot of extramarital affairs and live-in relationships are pretty common, because some people can do it because there's something not happening in their marriage or compatibility. It's easy way out. Some people can do it for the thrill. Some people just do it as a form of Don Juanism or Casanova complex. Very important stuff. These are Don Juanism and Casanova complexes, where you're continuously chasing and seeking to fulfill that validation and self-worth and self-image. Comes to that part of it. The Casanova complex is that Don Juanism is to reaffirm your masculinity. To reaffirm your masculinity, like, you got to keep sleeping with someone to reaffirm your masculinity. Can you
You
understand
should
how
have it inside
deep?
you.
It goes so deep. Some of these behaviors are a validation and justification that I'm a man, like subconscious, not a conscious thing. So that is also where the Madonna and the whore complex comes in. Some of the reasons why extramarital affairs happen. Madonna and the whore complex,
What is that?
explained by
Basically.
Sigmund Freud.
Hmm.
So Madonna is seen as an epitome of someone who's very godly and caring and nurturing kind of a figure, mostly the wife in the relationship, right? The whore complex, not in a literal sense, but the whore complex wise, someone where the excitement is high, the physical attraction is high, the chemistry is high. So this person, or this person, particular individual who sees sexuality in a split way, someone who's nurturing, caring, and all of that, I cannot think of them as sexual figures. And someone, I think of sexual figures, I may not see as that. So they have like the split complex, because of which they tend to choose women where, or man also, where they have no connection with. They get sexual attraction towards them and not towards their partner, because they love their partners, they're very interested in them. And also ED presents in different ways, right? There's a specific condition where a person kind of evolves around repeated relationships just to test themselves. They're not able to do it with partners because of these concepts and extramarital and other things. And once they've been in an extramarital relationship, if they're so connected with that particular person, the brain registers so deeply. When they come back to their partners, they're not able to perform with them. They're not able to enjoy with them. It can present as a specific situation till the mind is not accepting that. There's a deeper conflict. So unless we resolve those deeper conflicts, it's not there. So these are all the complications that happens in such kind of a relationship, and anybody who's into it or want to get into it should really get a deep insight and understanding on what this is
The pros
causing.
and cons, the risk
The
and
pros and
benefit.
cons,
Yeah.
like, the risk and benefit, pros and cons, like, no judgment. It's their own choice, their own life. It's okay, but see the pros and cons, see what you want to do, and select things, considering all the aspects.
I think it may be easier when the family is not in the same city as this person.
Yeah,
Then the
long
freedom is
distance
much more.
relationships.
Long distance relation. I think that becomes very easier. The freedom is more. It's like a license,
Yes,
license to do what you
justification
will.
that,
Yeah,
I'm just
yeah.
doing it here, and we're in different pin codes. Being in different pin
Pin
codes doesn't
codes.
mean, this is a justified approach. But then again, to each their own. But evaluate, because a lot of loss happens in these things. Mental health is lost. Lives are lost because of these things. Suicidal ideas, depression,
And
anxiety,
the
the
collateral
burden,
damage is very high.
collateral damage is there. Socio-culturally also, things are very different, right? Like how the society looks at these things. That also happens a lot. So, we need to think about
You
so
can't
many
be. Yeah,
aspects.
it can be very very true. So there. what he's saying is there's nothing right or wrong, good or bad, but the reality is everything has an impact. So don't think that I'll only get the good things and not get the bad things. It's a kata mita issue at the end of the day. Guys, everything has two sides. Every coin has two sides, whether you like it or not, whether you want it or not. And if you say no, I want only the spark of it, I don't want the other things, is not going to come. Nobody, it doesn't come to anybody without exception. It's going to happen. Next, so this automatically goes, this is, the workplace romance and affairs. But this automatically goes to the next thing, that is dating. Now, with this dating apps available and all of those things, I keep hearing this Millennium, Gen Z talking about ghosting and benching and what are all these things. First time I'm hearing from you all these things. Can you
So
let us know?
dating back in the days when I remember, right, when I was growing up, like dating was like a new concept that we didn't even know about, and then are we allowed to do that? And this is exciting, but it's become so normal, and I think normalization has happened now, and then dating is okay because it's also about exploring and opens up your curiosity side. It's not wrong
And
that
also building
you're
relationships,
building
understanding likes.
relationships,
Yeah,
learning through those
I
dating
agree. Which I
experiences
like
and
that.
all of that.
Which
Yeah,
is a fair thing.
fantastic. At least you don't have to think that what am I going to get and who am I going to get married, and all of that is not there. So dating is great, but the technology aspects of it has changed the game. Earlier, what would happen? You are either in a college or you're studying somewhere or you're in a common
Correct.
hobby or
That's what we
something.
did when we were
Yeah,
in medical
so that's
college. Yeah.
exactly what we. So what happens here is that you have some common interest, you have something else going on, so you're picking things from a certain pot. So there are a lot of chances for compatibility here because you're already in a common path and you happen to meet in a certain way and then going on. But dating apps have made it very mechanical in a certain way that you choose based on few criterias. You can filter things out. I want this, someone not looking, and there are various filters that are there, like I want to take it slow, somebody can place, and not looking for long term commitments, not. So hundreds of things because of which filters
Permutation
happens.
combination.
Permutation combinations are there, filters can be applied. So in this, what's happening is the constant cycle is real, like you can date and you can be going on a date that same night. While you're on a date, you could also be looking at someone else. That is happening. there
Yeah.
have been com- there have
And
been
I've heard that
there have been
in movies,
couples.
I have three girlfriends, four girlfriends. How are you managing four girlfriends with
Exactly.
I mean, they feel great about it. They're
Yeah.
stupid. They don't understand that it's not going to happen.
Right. So they feel bad in a sense that when the two people have met on a dating app, and during the dating somebody got caught seeing
Oh,
and
they got caught
exploring.
also.
They got caught. That is why they landed up in the clinic saying that this has happened. Like how? And then they have this pact. If they meet on dating apps, they have this pact that we should get off the dating apps after that, and then they get off. But they're all right, and then after some point
They get
somebody
back.
has installed the app again, and then the partner realizes there's a huge trust deficit. So the curiosity can get into a very wrong kind of curiosity. The exploration, which is an innate human nature, can get into the pathological side of it, crossing all boundaries, ethics, morality, right, wrong. So I think it's important to understand that dating can be fun, real, in a healthy way, knowing what to do and what not to do,
And knowing the lines.
knowing the lines of what not to be crossed, understanding the consequences of your actions and on yourself and others and society at large. That can be a very easy way to understand that. And then coming to certain dating patterns, which I see very commonly today because of so many explorative habits and relationships itself, modern relationships itself, in my opinion, have become very complex over the period of time. The concept of marriage is changing, the concept of dating is changing, concepts of relationship are changing. Normalizing, in the concept of normalizing, a lot of things are normalized. Earlier, it was very different. It was pretty black and white, if you ask me. Now it's become very gray. Everything seems
More
to be
gray
okay,
than black and
more
white.
gray than black and white, and we need to learn. It's not necessarily wrong, but we need to learn how to navigate it here. Earlier, there
And
were
also,
rules,
they should understand that it has
right?
its own impacts at the end of the
Impacts,
day. Yeah.
definitely impacts are there, and
They'll
then that
realize
is
it 20
the
years later.
actually yes. So that impact factor, if they know that it is
They
easier.
live for today and don't realize what will happen tomorrow. It's stupidity.
And dating behaviors also, which I was talking to you,
Hmm.
ghosting,
What is that? I have
love
no idea.
bombing,
No idea. Can you explain?
benching. Yes. Uh, these are all behavioral patterns that have been identified because of all the constant dating and all of that. Ghosting is like, when two people go out on a date and then there's no closure. Suddenly they leave. They don't say yes, they don't say no. This person is trying to contact and saying, like, are you in it? And how did you like? And what happened? Do we want to go out again? Nothing happens.
What is this called?
Ghosting. No closures given whatsoever. Now, this can happen in two reasons, because somebody doesn't want to express no to the other person. They feel like that is hurting them, and how can I no to this person and all of that. That is also wrong, because you're hurting the person anyway, right? So you need to understand that. And some people don't care about it, like, there is nothing in it for me. There's no point. I don't want to put any kind of energy in it anymore. That also may be the reason. And a lot of psychosocial factors or psychosexual factors, deeper psychological factors that are there. So ghosting is one of the things that is commonly seen. Love bombing is very intense.
So, what would you advise somebody who thinks ghosting is a great thing
Ghosting,
or the right thing? What would be
absolutely.
their advice to them?
Ghosting, when it's done, to the person who's ghosting, that is, somebody who is ghosting, that is not communicating, please realize it is easy to communicate. You should communicate. It is in your right sense to communicate to the other person. You may be saying no, or whatever you want to say, it may be hurtful.
Be honest.
Be honest, be
Be
truthful,
straight.
put it out there, give a closure. You may not be sure, but don't keep the other person hanging. If you're not sure, tell the person that, I'm not sure about it. I want some more time. Instead of keeping all the options open, but you are trying to play your own part, that is not the reason. And if at all you feel uncomfortable that you don't want to say no and all that, paraphrase it, rephrase it, change the narrative to a more softer tone, communicate, let the person know.
That you're not interested anymore.
Exactly.
That's the
And
bottom line.
the person who gets ghosted, don't keep pursuing. If somebody who's dated you or you have dated, once you ask, doesn't respond, two times you ask, doesn't respond, you give a call, doesn't respond, take that cue. Understand that for whatever the reason the other person isn't responding, don't get into this complex cycle that, because they feel rejected. Having the sense of rejection, they get into that obsessive compulsiveness where they kind of constantly go back checking, are you seeing my messages, are you not seeing? And because of, it's so difficult to forget anybody today, because they're just one call away, one video call away at the end of the day. So it's so difficult to forget. Earlier, out of sight was out of mind. Now there's nothing like out of mind at all, because you're instantly connected. So to the person who gets ghosted, don't follow, don't pursue, take their behavior as a closure.
So I think
Close it.
what I'm getting from this is, I think they should get in with this firewalling. First time, one or two times when they go, they should be mentally prepared. This may
Yes.
not work.
May or may not work.
If it
Keeping my
works,
mind open,
mentally we are prepared. He may ghost me, he may not ghost me. I should not get impacted by that because I
being more
deserve
aware.
I
Yeah.
deserve more things, and I might as well go to the next thing. It's like trying a dress and it didn't fit me, or the color didn't suit me. Then just give it and try another one. Dating is like trial room, literally.
Be
That's
more
all you try.
rooted in yourself, so that you are maintaining your
That's all.
mental sanity.
That's
Don't
all.
lose your
That's
mental
all.
sanity
I
because
think
of
so.
that.
I think so. So one. Secondly, what I'm getting good, it happens now. Then you go forward and then get it 6 months later, 1 year later. Think about it. If that person was like that now, and he expressed it 6 months later, you will be much worse than that. I think it's good. I'm always in the belief. Me and my wife always say, whatever happens, happen for the
Good.
best. Nothing in life happens by accident. So I think you have to look at the positive side of that and not the negative side. We have 1.5 billion people. Like, you only need one person. You don't need so many people. So I think you have somebody else going there. So don't worry
Yeah.
about that. That's what I think. And that's the first. And what will you tell, young boys who think great that they're having 4 girlfriends, 5 girlfriends, some of them at the same time? How are they managing? And, I've seen some actual interviews going on and things like that. What's going on there?
So I told you already about the Don Juanism and the
Ha ha
Casanova
ha ha ha.
complex, right?
Oh, this is
So
a part of that.
yeah, that is a part of that.
Ah,
Don Juanism, Casanova complex. Identify yourself. What are you trying to prove? Who are you trying to prove what? Fine, curiosity and all of that, but the way that this is going is, so many people are connected with you. You could be not
and he can
sincere
get
to
dumped at the
someone.
same time.
You may not be sincere to someone. So there is a responsibility in all of us when we are entering into a relationship, right? It is a unsaid
Absolutely.
responsibility that
Integrity.
integrity is to be maintained, honesty is to be maintained. Maintain that with the person. Be true to yourself also, because if you're not true to the other person, you're also not being true to yourself. You're being dishonest to yourself. So you're not even being honest to your own emotions. You're clueless about your own emotions. If that's the case, if somebody is dating so many things, take a step back, realize, why am I even doing this? Question that behavior, understand that behavior. You may not be able to stop it immediately, but understand, what is that I am doing this for? What am I getting out of it? And then, is it really fair for me, because I'm keeping so many people hooked and I'm lying, manipulating, cheating? Is this even fair? Is this in the right way to do things? Because there is consequences on someone else, right?
Yeah, think about it. The shoe can go on the other foot at some point of time and don't regret after that. And you don't get a second chance to make this. People can make mistakes, but don't. Stupidity is making the same mistake twice.
And
So,
people also justify this. I have also seen this,
hmm,
that I have been, dumped before, and I have been cheated before.
Hmm.
So somehow their trauma response from that
Or used to have more
is
people.
to justify that I have been done and I also am doing it. So there's
You,
nothing wrong with
somebody
it. So you
murder
have
you.
to heal. In those situations, you have to heal from your own traumas. If it is a trauma response, heal. If it's a
Eye to
personality
eye,
problem,
an eye
heal.
for an eye makes the whole world blind, is
Yeah,
what you
it
say.
doesn't, then what is the
Makes sense,
difference, right?
exactly.
Somebody did that to you. It's like somebody, seniors ragged me and I'm ragging my junior. Then we should break that cycle somewhere. Intergenerational traumas to be broken, some relationship traumas to be broken. Because if you don't, yeah, if you don't heal, you will bleed on someone who didn't cut you. How fair is it for the other person?
Very well said. Very well said. So this goes automatically. Next topic after ghosting is, what is that?
Love bombing.
Love bombing. What the hell is love bombing?
Love bombing is bombing someone in the initial phase of the relationship, right? There is a lot of attraction, obviously, physical chemistry, and there is a lot of huge amount of love. So, bombing someone with so much of love, so much of advancements, and being there, giving a rosy picture, gifting, prioritizing them, whatnot. After all these things, the relationship gets established. The other person feels fantastic. They get attached. These are all mating strategies, like, where the other person gets attached to you and then you already have them, and then completely changing the script.
And
Completely
it's done
changing the script.
intentionally.
Unknowingly sometimes, but at least some the patterns have to be
Why?
understood,
Why do they do that?
because they feel initially they have so much of things to give, right? It can happen in certain problems, like, it is more common seen in ADHDs and few other people where there's a oversharing, overcaring. They do feel that emotion. It's not like they don't feel. And I'm
It's
not even
genuinely
saying
done.
it's genuinely done, but after that boredom sets in and then they're not able to put the same effort again. So it could also be that it could be seen more in certain personalities, and sometimes it could be seen in manipulation as well. Now, it is not the same thing all the time, but the
Oh,
common
for you,
behavior is
but
there.
you will
So we
never
need to
know. It's
find out.
damn
We never
difficult.
know. We never
Very
know.
difficult it is.
Love bombing is, that is when, if somebody is love bombing, you realize you're doing it and take a step back and take it slow, because healthy relationships are built over patience and over time. It's not immediate and impulsive, right? And also, the other person who's receiving this love bombing may realize, okay, there's something more deeper. We need to put in, communicate, draw boundaries. I don't like this. Let's take it slow. So having that kind of a understanding between the partners can prevent, because after the love bombing comes the deep sense of rejection phase. The couple can go into deep phases where someone love bombs, idealizing them. Oh, you are my everything, and pedestalization. Then suddenly they devalue, and suddenly they pedestalize,
And
devalue.
this can go
This
multiple
can
times.
keep going on in the
Oh,
same
Rama.
cycle.
Mm.
So it is an example of a toxic relationship. The other person who gets devalued remembers the idealization phase, that I was idealized. He was so nice or she was so nice and she
So
was
they
giving
hope
me
that it'll come
everything.
back. So maybe some problem.
So that is called as breadcrumbing. Breadcrumbing
My God,
means
how much new things I'm learning.
just giving you small pieces of
Uh,
love,
like dog biscuit.
dog biscuit, and keeping you interested. And somebody is hoping that one day I'll get the entire loaf. Breadcrumbing also, and then this person is keeping the options open, just showing the carrot. Keep walking, keep walking, keep walking, keep walking, but never had the intention of actually giving the love. What is that we're trying to do here? So ghosting, love bombing, breadcrumbing,
Benching is what now?
benching, keeping your options open. I've kept this person on the bench. It comes from that IT industry, right? You have a project going on. I have so many people spare on the bench where, if needed,
Bench
I can
strength, as they say.
bench. So benching is something that you have someone as an option. So this is also to ensure that I feel secure. It's more about I, and it can be coming from fears. They can be coming from deeper insecurities, but nonetheless, it is more self-centered. You aren't
Hey,
even you
the
aren't
whole
even
everything
thinking
about
about the
aham,
other
aham, aham,
person.
me,
Allah,
me,
aham.
aham.
You aren't even thinking about the other person, what the other person is going through, and how, if you switch places, imagine, like, in a relationship, switch places and see, if this happened to me, am I okay?
That's a good thing. Ask yourself the
Ask
question.
yourself.
If you reverse it, how will you feel? That may help you to actually answer the question yourself. If you are having four girlfriends and that person has four boyfriends and you're one of them, will it be the same? Think about it, or the other way around. So, guys, it cuts both ways. Think about it. As you sow, so you reap. So, I think that's the way it is. I think that's an amazing thing. I didn't realize that so many things are going
Roller
on.
coaster.
Yeah, it's a roller
Roller
coaster ride.
coaster relationship, going high, going low, going high, And whenever you're high, you have so much of intense high feeling about the relationship. You feel you can't let go at all. And then they fail to see the crash. When it's a crash, they're at a crash, but they hope that they get high. So the roller coaster relationships, the idealization and devaluation system, all of these
It's like
things
a
are
serious
attachment
dopamine
patterns,
circuits, yeah,
dopamine circuits. And long-term relationship, oxytocin is important, right? Because gratification has to be sustained. They have to wait for it. Instant gratification, dopamine versus oxytocin, long-term. Which one do we prefer? This has its own merits and demerits. It's electrifying, intensely happy feelings can be got in this relationship, but the crashes are real. So, do we want it? That's a question that we need to ask.
Do you want it? That's the question to ask. Very well said. Say you brought a lot of time sex education in India. I purposely did not tackle it at that time. I thought I should tackle it at a point of time because we were in another flow. Now I know that the lack of sex education is haunting us. Considering that the Kama Sutra was there 1,800 years ago, can you imagine? We have a beautiful document, we have a beautiful thing narrating everything that is there. Somewhere we have lost it. I think we just bring back the teachings of the Kama Sutra and tell back to people or whatever else. Can you educate our audience about sex education and the need and how it has to be done? And
Yeah. So, I always tell my patients, well, and everybody in terms of if sex education has been done right and if sex education is there, we prevent so many problems that are happening and, who are coming to us.
and the myths and the
Myths, education, know your body, taking care, genitals things, and hygiene part of it that we are talking about, the do's and the don'ts, the consent.
the
If you
phimosis,
talk
paraphimosis,
about
everything,
everything,
everything, physical
then
and
you're
psychological,
landing up in your adolescent and adulthood fully prepared,
healthy,
fully
mentally,
aware, and
physically.
mentally, physically, emotionally, sexually healthy. Then how much of these disorders will actually persist if you have the right frame of mind, right understanding? I think that's very important. And also, not only from this positive sexual aspects, sex education also becomes important because there's a lot of sexual abuse, sexual trauma that's going on.
Especially
So
children,
boundly,
by
yeah,
the family
with
members
the
itself.
family members, children, so many things. I think if we don't talk to our kids and if we like do
The
a
good
hush hush
touch,
thing,
bad touch.
absolutely. So around 12 years of age is where more or less the logical reasoning can come in. So before that, we need to see how to educate the kids in a
At least
very
the good
easy
touch, bad
manner,
touch.
and then help them to say that this is a safe space. Teachers as a safe space. Parents are okay. You can come and talk, ensuring that it is okay to talk about these things, and any doubts you can come and ask. There is no restriction, no taboo, no stigma. At home we should start this, because taboo, stigma, where does it start? It starts at home. If you are breaking these things at home, then you're more liberated, and then you're able to talk about your problems, right? Or else the society means what? We. Everything starts at home and then collectively becomes a society. So all of us, if we take this approach, it's much easier for us to break that stigma. So educating the kids to be able to come and talk about friendships, keep an eye on what's going on, ask the kids, notice any change in the behaviors. All of these things are important. I think sex education cannot be stressed enough. It is a must.
So let me ask a follow-up question to that. Now, I know that a lot of the Western countries have a lot of sex education going. Now, are the sexologists out of business there because the sex education is going well, or are the problems different? I'm just
The
curious
problems,
because I'm asking
no,
you
very,
a
very good
natural next
question.
question.
Very good question.
Because if you think that sex education is going to bring in these problems at least by 50%, there should be a significant
I'm
measurable result.
sure, I'm sure it will.
You're sure
I'm
it will.
sure in my
Perfect.
practice, I see so many cases which was easily treatable. Like if the child knows that he has phimosis, it would have been treated then what's the
Got it.
problem?
So no,
So similarly,
no, I'm only asking from the larger audience saying
yeah,
that
yeah.
is it really worth putting this effort? If you go to education department, they will say the whole thing. If you go to school, we don't even have time to finish the syllabus. What are you saying this? What are you saying
I've
that?
tried
We
that.
can't
I've
handle.
I've
You tried
personally
all that?
I've personally tried talking to educators and head of the institutions. I'm trying to still push that, saying that this is very important for us to talk about these things. Make space for these things. Now, mental health is much accepted. You look at mental health 20 years ago, 25, 30 years ago, and where it is now, is so widely accepted. This is just going to happen. It is important that all of us realize the importance of sex education and understanding our bodies, and It has to
So,
be
I
done.
mean, maybe if the school is not interested, maybe somebody like you should start it.
Yeah,
Have maybe you should have a set of videos online that people can
we
subscribe
are
to
doing
and see.
that, educating it. I think
Perfect. I
we
think
are on that path.
that's the best.
We are
That's the
on that
best to
path.
do, because at least you have to start somewhere. You start. It can be a small movement that you do, a small seed, and then the whole thing may cascade to what is going on, and that will make a big difference. Because see, I think a lot of the things that I have seen, that the sexual abuse they've had as children, that also gets carried on, to the whole process that is there. So how deep do you dig when they come to you? Because you don't know, they may not tell you on day one that they've had this. Sometimes they've just sealed themselves off, they become numb to that whole process, things like that. And sometimes you have to actually thaw them out of that whole process to do. Not that they've done it by intention, they would just want to take it off. So how can you help such people, and how do we really get to the bottom of this? Because until you get to the bottom of this, obviously it's not going to change.
I do a lot of trauma work in terms of
Hmm.
sexual trauma, sexual abuse
Hmm.
work,
Hmm.
and women do come up and open up, and then we have to be trauma informed.
Hmm.
We need to know that we need to give them in their own time, and then the safe space, and opening up may take time, and we don't want to push upon it. And then there is should be the therapist or the psychiatrist. We should be more aware that any sense of anything looking like judgment will shut them down. So
Come
we
again,
need
come again, come again.
anything that makes them look like we are judging them will shut them. So trauma informed therapy process, and then at their own pace, and then we help them to uncover through journaling, through writing down, because sometimes they're not able to express. They can bring their thought diaries to us. We are able to evaluate that. So sexual trauma abuse survivors, they have a very hyperactive nervous system in terms of anxiety. Sympathetic activities are high. Their meaning towards sexual aspects are very high. So they have a real problem with anybody approaching, anybody coming very close. They are having a problem. Their partners, cognitively, they know that this is marriage or partnership, and we need to do so. It's important to work with this from a therapy approach and sometimes a medication approach also, and it actually
It
helps.
helps. It helps.
It helps.
I'm glad to hear
It
that,
helps
because I,
immensely to rewire them and to live a
I'm
fulfilling
glad.
sexual
I'm glad.
life.
I'm so happy. I'm really happy. No, because eventually we want to. Everybody is a nice person. They've gone through what they've gone. You can't blame anybody beyond a certain level, because if you keep blaming your past, blaming your circumstance, then you can't go forward. Somewhere you have to break this whole myth, and people like you are doing some fantastic work for that. I think it's great. So two more topics. One is about the stimulants, alcohol specifically. We've seen so many one night stands happening around alcohol, you know, and we have the famous Macbeth of Shakespeare's thing. Alcohol, increases the desire but
Take
reduces the
away the
take on
performance.
to performance.
Yeah.
Can you tell us about that?
Substances have always been intriguing for humankind, right? So it could be like alcohol or marijuana or any of these things, like, because the way that they alter the mind,
So
the
what does
way
that do? Just as a
they,
psychiatrist, you will.
yes. So alcohol, mainly what it does is alcohol taken in small amounts. I'll also tell some anecdotes around this, which is super important and interesting. So how the wiring can happen, right? What alcohol does, when someone consumes alcohol, it causes flushing, vasodilatation that can make them feel
I'm a
better.
teetotaler. I have no
Right.
clue. Mm.
So there's a flushing part of it, and then they feel there's a increased warmth in their body. And inhibition circuits, the frontal lobe changes, inhibition, they go off, anxiety is off, all of that, right? So this is what increases their desire, because they start
The
feeling
animal
like,
instinct comes in.
yeah, they feel like there's no inhibition, I can be more confident, the anxiety goes away, it suppresses those inhibition centers, so increases
Makes you
the,
feel good also.
makes you feel good, makes you feel more energetic in terms of like psychologically, and you feel that performance is high, or sorry, the desire is high. But where it goes away is the vasodilatation continues to be vasodilated, and then for inflow and outflow, if it becomes equal, then it will not be sustainable. Inflow has to be more than the outflow. If it's constantly vasodilated, veins are also dilated, right? So it comes in,
And goes out.
also goes off. For erections to happen, it has to be constantly one way, where the outflow has to be cut off, because after some point the cut-off mechanism, when the corpora stretches, the veins which are on the stop get sealed off, blocked in, arteries will keep getting the blood, and maintenance of erection happens. Whenever there's a cut-off, like from the veins also, the because of the vasodilatation, all are dilated, because of which what happens is the sustenance become a problem. That is why the performance are not there. That is the vascular aspects. Not only that, the sensory integration, how you're moving, what you're doing. That is why don't drink and drive is said, right? Because your reflexes are so slow. You can't move your body. You can't
The
perceive that.
foreplay doesn't
Only
happen.
the gross sensations are there. But sex is an interplay of, like, something that is so sweet in terms of you're able to look into your partner's eyes, feel that moment, feel that touch, tactile. How much can a drunken brain take? So the inputs that go also doesn't come. Vascular aspects doesn't happen, but desire is there because of the inhibition aspects of it. I think that is why disinhibition aspect of it is there. So that is why the frontal lobes are changed. So alcohol increases the desire, but take away the performance.
So what he's saying, what I'm saying is, we have two messages. As a neurosurgeon, I say, if you drink, don't drive. As a psychiatrist, sexologist, or sex health specialist, he's saying, if you drink, don't have a sex performance because it will not be good.
There is
So,
this question where people ask, is there a right amount of alcohol that I can consume?
so is there a right amount? Let me ask you that question.
is
Tell us
there
the
is there
secrets.
is there a right
Tell me
amount?
the
Like, if I just drink
secrets.
a glass of wine, if I just take a 30 ml
Tell
of
me,
alcohol,
tell me.
so it is about dose regulation, I would say, right? I'm not saying that everybody should get addicted. That is the anecdote that I want to bring in next. I will tell, like, there may be a very small amount that you take because it's not really hitting you that much. I'm not saying you should drink and do that, but for someone who's already doing it, right? That is not the advice professionally that have a drink and then have sex. But for someone who's already doing that, at least limit your doses to maybe less than about a 60 ml, if at all you're doing whiskeys and things like that, or maybe a pint of beer, or maybe a glass of wine. Wine at least is much better because antioxidant properties and all that, considering that. So, but any alcohol can be bad, maybe a fluctuation, so there's no guarantee. It may reduce that. And another reason why people drink alcohol is it improves your ejaculation time. So this is important to note, not only the desire, but also because of the way that the sensory, because the sensations is carried from where the glance and the penile sensations, they transfer, go there. And then the holding up also is there. Because of the way that the signaling is changed under the influence of alcohol, the slowing down of the signaling, because of which the release doesn't happen at all. So delay can happen. I have had
Is that
many.
good or is that bad?
It's good in a way because you are having improved performances, but how is alcohol good in a long term? Because what has happened in a couple of my patients, and then in certain situations, is whenever this got so programmed that when I consume alcohol, for the man that was, when I consume alcohol, I'm able to feel better, I'm able to be confident, it is increasing my libido, also increasing my performance in terms of lasting long. Every time they had to have sex, there was this need that he has to first go and drink and then only come to the bed. The wife was upset, saying that if she needed sex 4 times, he had to drink 4 times. So conditioning is not the point here.
Oh,
So
Ramachandra, how
hence,
each of it can become double-edged
though
sword
I
at the end of
asked
the day.
exactly, right. So
Ah,
I told, I don't only have to treat
oh,
you for the
Rama.
premature ejaculation problem. Now I also have to treat you for an alcohol
Alcoholic.
addiction problem
Oh, Rama.
and a conditioning. And without confidence, without alcohol, there is no confidence, and there is no organic confidence developed. And if you did it for 15 years or 10 years, how are you even organically going to be confident about sex?
Correct, correct. Crazy. What all can happen, in
Yeah, it is
just,
common. It is happening. It is
oh, I
happening.
can imagine.
Using it and not using it is a personal choice, but definitely without it also can be easy, and without it can be much, much better experiences rather than alcohol fueled or a drug fueled sexual experience, isn't it?
How is the effect of alcohol on the same on the man and the woman?
So flushing can make the inhibition go off, and also vascular vasodilatation means, like, engorgement of blood in the genitals. So it can be very helpful for a woman where lubrication can be there, and also engorgement, because when we look at the desire pathway, right? First is the desire, then is excitement. In excitement, two paths: mental excitement, physical excitement. So whenever the foreplay starts and all of that, which is done or told to be done more because of the excitement increases, mental excitement increases, and rush of blood to all of those organs. Vasodilatation happens, heart starts beating faster, shallow breathing happens, release of so many neurotransmitters, and relaxation also happens. So that is where the engorgement of the genitals with small amount of alcohol, where that is where some women and men consume a little bit of wine and these things, so that it helps them to the physical arousal also means mental arousal, right? So once I see body feeling this, mentally also I'll feel on. and mind being on, then body also being on. So again, mind and the body connection everywhere, circuits to the sensations. Healthy talks, yeah, healthy minds talk about sex, and safe societies learn from it. So we are making it safe, we are educating people. So it is so important. And I'm glad that, you are doing this today, because I think this is a very educational session for so
So it'll
many
be the first
people.
time you've done something like this, I think.
Yes.
Such a good conversation.
True.
So as we start winding up, what I'm just I started with the Dharma, Artha,
Kama
Kama,
and
and
Moksha.
Moksha. So so I think that's a fundamental software framework into which they have to start running their life, guys. After once you got this framework in place in any way that you want, then you start putting each piece of the puzzle together and see how are you going to operationalize each piece. But each piece cannot operationalize independent of the other piece.
Exactly.
There's a strong dynamic interplay,
Interplay between
one
that.
inside you as a person, inside your spouse as a person, and both of you together. You have to be a combined dharma, artha, kama, and moksha. So it's become from I to we. So if you have that, that's what I'm suggesting. Then what happens is you have a safe space to communicate the pleasures, the not so pleasures, the upsets, and everything else, so that you people are open and communicating. You have to give up your fears. You have to say about it. But then maybe I can help you, or you can help her, or she can help you, or whatever it is. At the end of the day, that's what has to happen. And every problem that Dr. Shivadeva said can have a physical component, can have a psychological component, and they can have a couple component. I think if you address each of it in an organized way, then you know where the interplay is happening. Then each of it can be handled independently, together, whatever it is. Then there's a method in the madness rather than getting overwhelmed by this whole process. Is that a fair summary of what you have said?
Absolutely, absolutely. Because it's like putting these pieces together, right? So it is not about one. And we could start with anything. We could start with one piece, then we can add another piece. Ultimately, the entire picture comes into the play. I always tell the couple that you have a canvas, it is your own. You paint whatever you want. You do not have to look at somebody else's canvas and
Canvas.
what they're
Correct.
painting.
Correct.
Every painting is
Absolutely.
so unique, right? You create your own life, you create your sexual health, you create your mental health. You are in control. So that is the most commonest fear, like I may lose control. So like you rightly mentioned, and what we are discussing is physical health, emotional and mental health, hormonal health, lifestyle problems, managing stress, integrating the holistic health. Sexual health is an indicator of so many diseases that we know. Anybody comes with sexual health problem, I'm diagnosing so many physical aspects, psychological aspects, personality related aspects. So many things. It's a tip of the iceberg if you look at it. If sexual health goes off, it's an indicator that something deeper that we may want to address, and it can actually help. There was one patient I referred to Jayadeva for it, and he was diagnosed with cardiac problems.
Really?
Yes.
So, since you said that, I've had personal experience of two people. One on the first night had an aneurysm bleed and died,
Yes.
because of the severe excitement. Other guy had a massive MI and died.
Yeah.
And, one is a brain hemorrhage, other one is a heart attack on the first night. So, it can happen because of the sudden surge, the excitement, and everything else that's happening. So, anything is possible, guys, plus or minus. You want to
You
say
mentioned
something?
the same thing, right? So I have someone, like, one of my patient who had an aneurysm, but she got better, she's treated, all of that is much better. Post that, there's so much of fear of intimacy.
Oh, the other side, the other does
It
happen. Oh,
it's real, because anything may happen. I don't want to pump my blood so much because it may cause a rupture in my brain. This is also true. When something like that happens, the
and
post that the
it's not
sexual,
psychological. It's real.
yeah, it
It
is
is
real.
psychological. It's real.
It is
Patient's already
real.
gone through it already. It's not imaginary. Also,
Drive away messages, psychological is not just in the air. It is real. Mental health is real. Mental health is real. It is addressable. It is treatable. So the real fact is that any of these problems, easy to identify with the right way and right approach, a combination approach, holistic approach. Anything is okay to be talked about, and safe spaces are available, and you can get definitive results which are helping you to lead and improve your overall quality of life.
brilliant. I think that's the best message you have given at the end. I think we should call an end to this podcast. We had a fantastic talk on on the guys. Did we keep up our promise? This is for a Valentine's Day special. It's also the World Sexual Health Awareness Day around the same time. So I wish you all the best. Please work on yourself. This part of life is most important to have a fulfilled life. Each of us deserve it. Each of you people deserve it. And we have made a small contribution to help you guys get aware of the fact these are there. Some of you may not even know so many layers are there. We have unraveled those layers for you, at least attempted to do. You also understand that it has to be treated layer by layer. Dr. Shivadev has clearly told you that it's multidisciplinary. You have to have patience. It's not a Maggie noodle solution of 1 day, 2 days, or one sitting, two sittings. Please have the patience. It is worth it. Shivdev, thank you very much. Keep doing the good work. May your tribe increase.
Thank you. Thank
Thank
you
you.
so much, sir,
Thank
for
you.
calling me here. And, this was wonderful. And as you were rightly saying, the way that you have taken this, you are the best person to have interviewed me for this and then brought out so many things that was down there. And I think this should help so many of the people who are watching this. I hope this is a great work that you're doing, education, because doctors are, as doctors, we're trained to treat and, be in the OTs and all of that. Taking time away from all of that busy schedule. You have a very hectic schedule, busy schedule. Despite that, this is a social cause that I think you're doing, and I'm thanking you from the bottom of my heart for having me here today and then having had this
Pleasure.
conversation with me as well.
Pleasure. So, to tell our viewers, we have shot nearly 30 episodes so far that you have seen. And none of the episodes have been edited. What we shoot is what you see. That's my promise. It's a unfiltered conversation. You see, that's the way it is going. Number one. Number two is don't forget to subscribe to our channel. Again, I'm reminding you, the YouTube channel, the Instagram channel. Hit the like button, the bell icon, share this video and the reels, and for sure, please comment. Put your heartfelt comments. You never know if you need to do a follow-up video with him. We'll do. And one thing I told Shivdev before I started, I said, Shivdev, if there's one person who can interview you here, that is going to be me. And I hope I've kept my promise.
Rightly said, and
Kept the
you've kept the
promise.
promise.
Thank you very much. Jai Hind.
Thank you.
We gift a book that we have written to every guest, and it's called Rebooting the Brain. So maybe we should write one book on this at a
Thank you,
point of
sir.
time. I can help you. I become an expert in writing
Please,
books right now.
please,
Why don't we
please,
do that?
please,
Let's
please.
rebooting the brain from the sexual health aspect of it. So this is from us. Thank you very much. Please read it and give me your feedback. We would love to hear it from you.
Sure.